Mental Health Secrets, a practical guide to understanding mental health problems. A manual for comprehending various mental health issues and diagnosis. We will tell you of the various problems and mental illnesses that affect millions of people daily in this guide. We will also provide you with information on strategies that might support both individuals who are in need of support and you in finding it. Table of Contents. Auditory Processing Hyperactive Disorder ADHD Case Study Attention Deficit Disorder. Anxiety and Learning Disabilities Mental Health and Schizophrenia Mental Disorders and Diagnosis. Cognitive Mental Health Disorders Mental Health Issues. Questions to ask mental health experts Symptoms of mental illness. Delusions to hallucinations, mental wellness mental health Psychogenic and dissociative amnesia Sexual disorders and mental health. Dangerous personality disorders Explained multiple personality disorder and post-traumatic stress impulsive behaviors in mental health. Somatoform mental disorders. Alcohol and drug abuse in mental health Behind the walls of the mind Behind disorders with Inside the night Situational management disabilities. Mental illness in underdeveloped child separation trauma and mental health. Postpartum depression. Relating to others with disabilities Understanding mental illness. Entertainment and mental health Ill minds suppose alike. Group therapy. Education and mental health. Practices in mental health. Criminal minds in mental health and history. Depression kills. Mental health and traits. Mental illusions. The mentally impaired. The deviant in mental health. Mental health secrets. Antidepressants in mental health Medicines in mental health. Mentally deranged. The mind outdoor the mind. Therapeutic strategies in mental health. Types of disorders Passive-aggressive disorders and mental health. Dependent personality disorder and mental health The psychic minds in mental health. Antisocial and psychopathic links in mental health. Auditory processing hyperactive disorder ADHD. Auditory processing hyperactive disorder is known as attention deficit hyperactivity disorder, much better called ADHD. Auditory processing hyperactive disorder is an item of intricacy in processing and making sense of the auditory stimuli in the non-attendance of tangential hearing deficit, hypertension shortage coupled with attention disorder ADHD. Auditory processing hyperactive disorder is widespread with children and teens, instead of grown-ups. However, the auditory processing hyperactive disorder has no narrow-mindedness and more adults are identified at present. Indication of auditory processing hyperactive disorder consists of inability to use common without care of hurting sense. Constantly the client verbalizes other people, and continuously these individuals feel of fantastic sense of boredom. Nevertheless, exhilarating jobs may be managed without further complications occurring. The many that suffer symptoms of auditory processing hyperactive disorder otherwise ADHD, ADD and acoustic disorders also demonstrate behaviors, which include spontaneous habits. The patients often act out before believing, and often neglect the effects of their actions and habits. Auditory processing hyperactive disorder, ADHD, ADD is a cranial nerve that links the inner ear with the brain, and transfers impulses, which manage the balance in hearing. When the auditory process is disturbed, the client is frequently intensified and hyper symptoms increase, which leads pointlessly to the attention deficit hyperactivity. Hyperactivities are signs that consist of unyielding energies. Once these energies are cut off, the patient frequently acts out wrongly. The disruptions in the hearing and the balancing frequently take place when the main nervous system is affected. As soon as the main nervous system is disrupted otherwise other symptoms happen, requiring the patient to respond. Recent studies have shown that the main nerve system plays a crucial function in the functioning of health, finding out and coping skills. Scientists also found that disorder, ADHD, AD, and the auditory processing hyperactive numerous other related disorders are associated to the neurotransmitter deficiency ailment. The neurotransmitter procedure is associated to the central nervous system. For that reason the issue is obvious. If the central nerve system is dealt with, efficient treatment might be in order. In an effort to resolve the many conditions that plagiarize our system daily, we need to take a closer look at the central nerve system. Diet is another concern that is associated with lots of disorders. Given that, most people with medical diagnoses typically do not have adequate dietary foods that help them stay healthy. If you think your child, pal, member of the family, or other loved one has symptoms laid out in this post, you are recommended to call an expert that deals with this kind of detect. If you delay, the client might suffer enormously, as well as might even dedicate auditory suicide when the client does not see a way out. Processing hyperactive disorder is common in many children, and frequently the children who suffer resort to alcohol and drugs as a source of relief. If your child is thought of suffering this condition, it is very important that she or he get appropriate treatment and therapy. Alcohol and drugs is a leading cause to suicides, jail, crime, etc., so to secure your kid you need to take the appropriate steps to recovery. As the mum of 2 teenage kids, one that suffers auditory processing hyperactive disorder ADHD, I can inform you delay in treatment is fatal. It is likewise essential that you offer the required diet to the strategy to avoid deficiencies. An excellent diet strategy, education, treatment, and chiropractic strategies can natural supplements, combined with help your kid. Because the central nervous system is affected, it is smart to receive treatment from sources that specialize in this location. Psychiatrists, psychologists, therapists and other specialists do not always have the responses. Therefore, it is essential to understand the knowledge of the professional treating your kid. Medications are discovered to be the leading cause for psychosis, break-off schizophrenic episodes, and so forth. A lot of the mental health experts concentrate on dispersing medications in the treatment of ADHD clients. For that reason, natural deposits, chiropractors, and other sources might be the solution for dealing with auditory processing hyperactive disorder, ADHD, AD. It is very important to find out all you can on the many kinds of conditions and mental disorders that are impacted our kids, so that you can discover a willpower if your kid is suffering. Learning the case studies of attention deficit disorder can guide us to assist. Case study: attention deficit disorder. Research studies have shown that attention deficit disorder (AD) has exposed that fish oil might help slow down signs of ADHD (AD). The symptoms of ADHD ADD consist of coordination specials needs, discovering perplexity, high blood pressure, emotional impairments, failure to focus, ADHD ADDs or impulsive habits. Typical identifier: short stress span, and more. With numerous grown-ups and children today, and the studies are revealing that attention deficit disorder patients that use fish oils provide more relief than Adderall, Ritalin, and other medications that are often providing to ADHD ADD patients. Medical professionals have actually recently discovered that thyroids, lead poisoning, and other chemicals disabilities are accountable for attention deficit disorders in children. The high epidemic leads scientists to reveal lots of possibilities to discover answer to this continuous scope of disorders. Medical professionals have consisted of restorative methods, combing the strategy with medicines and education. The treatment integration for ADHD ADD clients have proved efficient. Nevertheless, medical professionals are extending their search to discover an option for ADHD ADD patients, approaching stimulants to fix the difference. Recent research studies have found that stimulants are the leading cause of other epidemic issues in both children and adults. Children today are dealt with for psychotic episodes, including characteristics, tendencies, etc., as a direct result of medications given to ADHD ADD patients. Ritalin and Adderall, as well as other promoting drugs, are linked to psychosis, psychoses, bipolar, manic depression, and schizophrenia episodes. The soaring ADHD ADD rate of children and are guinea pigs for the grown-ups diagnosed with medical professionals that recommend the healing medications. Is it any wonder the world is increasing with problems? Natural resources are presently studied, as the researchers are now discovering that natural deposits are a much better solution than what is used in stimulants. Scientists have actually also found that the many that are identified with ADHD ADD frequently use alcohol and drugs to relieve their discomforts and sufferings, and often the stimulants are addictions. Case studies with attention a direct reason for the deficit disorders have revealed that docosahexaenoic acid DHA is an essential element to the main processing of the brain tissues. Studies has actually revealed that the loss of memory, anxiety, ADHD ADD symptoms, along with the many other associated issues might extremely well be connected to low docosahexaenoic DHA. Researchers are constantly searching for services that are more reliable to dealing with the epidemic of ADHD ADD, and currently fish oil is the ultimate service, coupled with treatment and education. Off track. I am going to jump off track at this point, considering that I have done my own analytic studies, research, and observed my son that suffers with attention deficit disorder. I have actually found in my research studies that chiropractic solutions are a fantastic resource for efficient correction in ADHD AD. I have also discovered that concentrated omega-3 paired with Spectrient is likewise practical to those that experience attention deficit disorders. My kid was on medications for more than 4 years, and all the issues resolved above are true. My son suffers psychosis, ADHD, stress and anxiety, schizophrenia, as well as other signs. Considering that I stopped going to the doctor, and treating him with natural deposits, my son is now improving with his behaviors, actions, and so on. There are days that are bad for him, but he is now able to confess when he is wrong. I discovered that physicians do not constantly have the answers, and believe that the medical professionals that study ADHD, ADD requirement to listen more to the patients and the moms and dads, considering that these people are constantly handling this kind of circumstance daily, and sees more than any physician could ever see. In my research study, I likewise observed that lots of counselors are doing not having the treatment for ADHD, ADD clients, by quickly sending them to a psychologist for medications. I am firm follower that education is the supreme service for many of those suffer with medical diagnosis, including disorder, schizophrenia, psychosis, psychotics, split personality, ADHD, ADD and so on. The only disorder or defect that I suggest to keep as far from education in some areas is sociopath and crazed. I viewed as these personality types utilize education to their benefit to hurt others. I have a second boy with demented propensities, periodic explosive disorder, oppositional defiance disorder, impulsive control disorder, and other disorders, and as I watched him, he studied the legal structure in an effort to find a way to eliminate and get away with it. Anxiety and discovering special needs is another subject we require to attend to. Anxiety and learning disabilities. Anxiety and discovering impairments are often misinterpreted. Learning disabilities and depression prevail mental disorders that impacted millions every day. Studies has actually shown that kids suffering with finding out disabilities have intricacy discovering to speak with complete confidence, take care of their health and bodies, and often suffer with the inability to deal with stress and the common pressures of daily living. A number of the clients that suffer anxiety and learning special needs are declared to be borderline retards. Depression is associated with psychological frightening, youth traumas, chemical imbalances, inadequate nutrition, and other factors, so for that reason it makes sense that it is believed a form of retardedness. Learning disabilities are typically stemmed from lack of education, favorable influences, and miscommunications. Often people that struggle with anxiety and discovering special needs are overwhelmed, and this too creates an issue for the patients. If you notice anyone around you that is struggling with symptoms of depression and finding out special needs, such as lack of enthusiasms while playing, misery, feelings of despair, self-destructive propensities, and negative thinking, then you must instantly get in touch with an expert to play it safe. Anxiety is serious psychological health disorder and it should not be ignored. Frequently individuals that suffer depression or discovering special needs utilize alcohol and/or drugs as a source for relief. This only creates a bigger problem, and assistance is required immediately. Depression also causes fatigue, lack of interest, and habits that might lead to prosecution. Lots of people that suffer depression are impacted by common issues, such as financial obligations, deaths in the family, and so on. They typically have the failure to deal with stressor, and frequently need support as a result. Physicians typically deal with such clients with medications, consisting of Prozac. Nevertheless, current research studies has actually shown that the many medications used for dealing with depression and learning abilities have side effects that make complex to identify. It is just recently been discovered that anxiety may be connected to tendency for understanding after the fact, for immersion in the mind's eye, a regular accompanying buddy to the restraint, if not antisocial, depressive irritation. I beg to vary with this viewpoint, given that many encounters I've come across with clients that suffer anxiety and discovering capabilities, they often strive for attention. This is a complete contradiction of antisocial, given that antisocial is a diagnosis where the patient refuses to associate in society. Commonly depressive maniacs, or handicaps that consist of depression and discovering abilities, they typically aim to discover the answers to their suffering, yet disregard to see the responses when it is in front of them. The mind is a difficult thing, and when somebody tells someone that his her emotions are not real, it is only rejecting the true problem. It is very important to acknowledge the issue, without promoting a label on the patient. Regardless of the many viewpoints offered to us, one being that when a person is labeled, they are often viewed as a label by counselors and other individuals. The key to getting rid of any issue is finding out to accept your impairment. When you accept and recognize the issue, in my experience it has proven successful in treating the diagnosis. The issue then is not necessarily on the identify itself, rather it is on the many professionals, patients, and others that refuse to accept that the issue exists. Instead of analyzing the mind, it is likewise crucial to take a look at the medical diagnosis closely and pay extensive attention to the symptoms. When you start dealing with each individual sign separately, you can then work through the other problems slowly. The problem lot of times is professionals want to rely on medication versus treating the patients with efficient treatment. Let's take a look at a medication that is provided to patients with schizophrenia, antipsychotic, and other associated diagnosis. Ziprosidone (ZIH appreciation IH-DON), for example, has possible threats consisting of neuroleptic malignant syndrome, effect on glucose or sugar level, impacts blood pressure levels, and promotes involuntary motion disorder. Now anyone that knows depression and finding out disabilities need to be smart to avoid risking or promoting such complications. The noted threats are often direct links to the central nervous system, and most people with depression and finding out disabilities need to prevent any locations, including medicines that affect the nervous system. Schizophrenia is another concern that mental health experts face each day, looking for options to resolve the problems. Mental health and schizophrenia. Schizophrenia has plagued our systems for several years. Today, psychological schizophrenia health experts are discovering more cases of than they counted in the past. Schizophrenia is absolutely nothing to have fun with, and anyone disregarding this detect is just throwing fuel to the fire. Schizophrenia has several levels of diagnostic symptoms, yet anybody with schizophrenia need to be dealt with immediately. If you understand anybody with symptoms including paranoia, hallucinations, voices, and so on, get in touch with an expert right now. Do not wait, because the more schizophrenia establishes, the more others, consisting of the patient, are at danger of risks. I am a survival of a daddy that suffered paranoid schizophrenia, and anybody around these people undergo danger, pain, suffering, torment, and more. Not just does this type of client suffer, anyone around them will go through tremendous discomfort and suffering. Common words that schizophrenias connect to others is, they are concerning get me, or they tell you that the CIA KGB is out to get them. Hallucinations affect the sensory in the sense it communicates messages or else nerve impulses to the sense organs, and signals the message to the switchboard, thus creating a suspicious force. Therefore, the client is often suspicious of whatever that is near him, consisting of things, individuals, locations, things, etc. When the suspicion embeds in, if they do not drive you crazy by this time, they might act out violently thinking they are protecting. Beside a psychopathic or sociopath, schizophrenias are nothing to take lightly. Given that the twin location of the brain is impacted, and the mind is broke off from truth most times, it is important to treat these clients instantly. Medication in this case is needed to prevent episodes of schizophrenia. Schizophrenias frequently hallucinate when they observe things around them, view noises that impact or activate their symptoms, odor, odors, taste, and even sense or feel things around them. Scientists for years have been shocked by this diagnosis, and are struggling constantly to find answers to the many concerns relating to schizophrenia. I will not enter into great detail, but in many cases when schizophrenias are saying they are concerning get me, we might require to step back and examine this common saying more closely. Hallucinations resemble or the like psychotic breaks, given that the patient frequently loses contact with reality. The voices frequently tell them threats alert, which is often untrue. One example of a paranoid schizophrenia episode can be seen with the Oklahoma bomber. If you notice anyone around you that laughs for no obvious factor, shout at the air, consistent muttering during periodicals, covers ears, and so on, this person might be a victim of schizophrenia. Most patients with schizophrenia are typically suffering by the age of 13 and up, and many times a patient is not treated till later on in life, just because experts play around with dispute. This is due to the fact that particular signs of schizophrenia are discovered in other types of conditions too. The downside is when a schizophrenia is not dealt with early, they often break off into paranoid mode, and this is when the medical diagnosis is at its most harmful stage. Schizophrenias often reason with the voices. If they begin hearing the voices in their head, schizophrenias have voices within the mind. The client might declare the voices are from God, Satan, or even an alien. The visual perspective of schizophrenia breaks is somewhat similar to the voices. Typically schizophrenias think that are noticing or seeing others around them talking when they are not. They may tell you that the KGB or the CIA concerned the door, when at the deliveryman dropping off a bundle. Many experts today are claiming that mania or anxiety has signs similar to schizophrenia. Voices are an example that professionals are claiming affects depressed or bipolar clients. I second guess them considering that I've been around schizophrenias, depressed people along with bipolar clients, and from experience, I believe that the latter are suffering thought processing patterns that are misconstrued as voices. Anybody with anxiety, bipolar or mania typically suffers suicidal propensities, which is not common in schizophrenia. Schizophrenias would much rather kill than pass away, although there has actually been few cases reported of self-destructive behaviors. Mental illnesses and the many diagnoses is an ongoing battle. Mental disorders and diagnosis. What is medical diagnosis? Lots of people challenge mental illnesses, declaring the mental disorders do not exist. Therapists are typically identifying individuals every day, and to understand the symptoms and medical diagnosis you must understand the underlying and overlying controversies that fall in between. Mental health is essential for daily life. There are many indications that show mental disorder, and typically individuals disregard these signs as a misinterpreted level of understanding on the client's part. The truth is, when an individual has a common denominator, she or he frequently believes plainly without interruptions, but when an individual is in consistent disruption, there is probably a problem existing. Medical and mental work together, and this is where doctors, psychiatrists, psychologists, counselors, and numerous others are typically puzzled. The hidden problems lay somewhere between belief, custom, miscommunication and so forth. If you are treating a person thought to have a mental disorder, you require to pay very close attention to comprehend where I am coming from. Many experts, individuals, political leaders, and others are ready to change the way we all think, believe, feel, etc., altering us to comply with another person's point of view and so forth. Check out in between the lines and you will see a part of the issue already. When individuals are attempting to change what another person believes, it is stepping on toes. When you step on toes, there are undoubtedly consequences, and frequently individuals stop working to see why they belong of that effect. Let's take a look at a few medical diagnosis and signs and where we play a large part in the disruptions. Beginning with the little doses and working our method up, we can see that bipolar is a common condition in society today. Do not tell me you do not understand somebody with bipolar, unless you have actually been separated for countless years. I don't believe you. Bipolar is a common disorder today, and lots of people stop working to understand what it truly implies. Bipolar is a mere chemical imbalance. This suggests that the brain is rejected of nutrients that are valuable for reproducing good results. The issue is most people identified with bipolar are overlooked in the sense that childhood experiences are disregarded. A lot of us deal with traumas, dramas, and other stress factors in various ways. No one person is the same, and none of us must be expected to deal with stress factors like another person. To do this is initiating more problems. Initially, all of us have triggers, and when activated all of us react differently. Some of us respond adversely, while others of us decide to ignore the issues. The ones that disregard the many issues are typically not hearing the messages in between, and this is what separates mental disorder from the so-called normal mind. First-hand experience. I want to put my money on the psychological ill since they are more apt to listen, hear versus the so-called regular that only hear what they want to hear and rarely listen to what is stated to them. There are numerous that will contest mental disorder, however these individuals are only intensifying to a fire that has already been started because Jesus and prior to strolled the earth. I will not walk with Cain and Abel, given that you probably do not want to go there. However, the truth is jealousy, hate, and other associated concerns raised sufficient hate in Cain that he killed his own bro. The fact is mental disorder has been around for years and the links are jealousy, hate, fornication, lies, etc. And while these are the underlying concerns that focus on mental disorders, the overlying issues are delegated be attended to. Breaking it down, what part do you play in the medical diagnosis of mental disorders? I think if you read in between the lines, you will soon discover. Mental illnesses is not just an identifier, but a belief, an idea, and procedure of comprehending what is taught to another. Finally, I study human behaviors and criminal justice, and I will be the very first to inform you that all of us contribute in mental illness and psychological health, and we all are responsible for the problems that we deal with every day. Knowing the mental health signs is very important to discovering how to fix the many issues all of us deal with today. We need to analyze cognitive disorders to get a much better understanding of mental disorders. Cognitive mental health disorders. Therapists around the globe are constantly searching for responses that help them understand mental disorders. Cognitive conditions consisting of dementia, delirium, alcohol-induced conditions, and other related disorders are under consistent studies. Most cognitive conditions listed in this article have traditional denominators, consisting of loss of memory. Most of the medical diagnoses are connected to disease of the brain or biological illness, or else alcohol addiction and related chemicals. Frequently people with cognitive conditions have problem with speech, including relating with others, and thinking. Their judgment is typically impacted, and their ability to recognize is frequently comprehended differently than the regular mind. Often the clients suffer anxiety, inflammation, fear, and other related signs that might easily be misdiagnosed, considering that bipolar has similar characteristic symptoms. Delirium includes symptoms that target the awareness, signals confusion, impacts speech, loss of memory, imposes worry, stems depression, and lots of other signs that affect the client. Physical signs likewise insult the patient. Increased heart rate, disturbance in sleep, nausea, and lots of other physical symptoms make it tough for the client to find comfort. Recent research studies have revealed, however, that medications can increase signs in the condition, including strokes, cardiovascular disease, imbalances and so forth. Dementia is a kind of Alzheimer illness that triggers the client to lose memory, discovering failures, language disabilities, and so forth. AIDS, strokes, heart failures, and other chronic issues may trigger a person to suffer dementia. Individuals that suffer dementia may individual hygiene incapacities, bad judgment, avoidance, character altering, and so forth. The diagnoses can be misconstrued for several disorders, consisting of major depressive. It is necessary to prevent alcohol if you are experiencing any signs of mental illness. Alcohol only increases the signs disruptions and causes more harm to the patient. Lots of psychological ill clients will turn to alcohol and/or drugs to discover a source of relief from their suffering. This is not the option and should be avoided at all cost. Alcohol-induced disorders are classified in cognitive disorders merely due to the fact that the symptoms belong, and much of the diagnoses are a direct result of substances in a lot of cases. This is not true of all mentally ill clients. Therapists have dealt with many clients that have never touched alcohol or drugs. Although numerous therapists will look for this as a reason to eliminate the worst-case situation. Alcohol-induced disorders are also referred to as Korsakoff syndrome, which impacts the memory trait. Signs typically consist of memory loss, denial, indifferences, sometimes violent habits, and so forth. A lot of alcoholic or drug patients are direct-linked dietary deficiencies, which often include B-complex. It is often difficult to deal with alcohol addiction, however it is possible. It takes the person to will themselves free of the compounds. Approval is the beginning of healing. Many patients that are alcoholics or addicts sometimes treated with medications for physical problems. I have acknowledged compulsive medical deliveries, and frequently the medications that are offered to the patient with trigger the alcoholism signs. High dosage of B-complex is frequently offered to patients in extensive inpatient treatment where alcohol and drugs are the issue. If the client is at an early stage, then it is possible to treat the client effectively. Nowadays alcoholism is impacting children, and it is time that we take an action to stop the boost of alcoholism and drug dependencies, before it is too late. Therapists are continuously looking for a method to resolve the many mental disorders today. As they study, they are discovering that more problems are out there and it just slows them down, since when they discover new discoveries they concentrate on this problem, pressing the other medical diagnoses to the back quickly or else linking them together. Mental illness, whether it be alcoholism or other diagnoses, is not a game. There are millions of people around the world suffering every day and are seldom getting the care they deserve. We all individuals and all of us should have care, consisting of, if not more so, those with mental disorders. In the next post, we are going to talk about more serious disorders, consisting of antisocial behaviors, obsessive-compulsive habits, schizoid, schizotypal, etc. I believe it is important that all of us have a basic knowledge of the many diagnoses worldwide. Having a standard understanding can assist us to cope or assist someone that is suffering mental illnesses. Understanding psychological health problems helps us to find a way out of the darkness. Mental health issues. For several years as specialists, scientists, philosophers and numerous others have taken a look at psychological health, looking for answers of existing impairments. Initially, there are lots of kinds of mental illnesses. The types include adjustment disorders, bipolar, sexual disorders, dementia and delirium, as well as numerous other disorders that impact people every day. Taking a look at adjustment conditions, which is a typical medical diagnosis where the person has problems adapting to tension. Bipolar is a very common condition, and often I believe the diagnosis are misconstrued. Bipolar or manic depression affects individuals by bringing forth signs such as hyperactivity, extreme stressing, and mood swings and so on. After handling an individual for more than a year with bipolar, I can tell you up front that the individuals can drive you insane if a solution for treatment is not ministered to right away. The persons frequently suffer suicidal tendencies, which I have seen firsthand that most of the times the patient is seeking attention. Couple of really threaten suicide and really carry it out. The majority of people think that bipolar is a mental disorder, however the reality is bipolar is directly connected to chemical imbalances, which indicates it is more neurological than psychological. In other words, the brain has chemicals that were not nurtured. For that reason, when the nerve system is impacted, so is the mind, and this is why it is labeled under psychological health. The reality is recent studies has straight linked bipolar to origins or genetics. Studies have actually revealed that most patients identified with bipolar typically have a family history of mood swings in the family. The problem then is dealing with the diagnosis effectively without over-medicating or putting the client on medications that affect psychotic breaks. I discovered that the root of the chemical conditions that promote state of mind swings is typically connected to youth advancement and trauma that was never ever dealt with. If the mind has injury in the back and it is not brought to the front for knowing, accepting, and handling, then the bipolar symptoms will frequently increase as a result. Yet, bipolar is not the only mental health issue we are facing today. Sexual conditions are another type of disorder that separates itself totally from bipolar, modification conditions, and other kinds of diagnosis. Sexual deviation is typically linked to pornography, abuse, not always, and other types of unfavorable behaviors. However, recent research studies have shown that serial killers or else psychopath or sociopath behaviors are genetic. Some research studies have actually attempted to prove that the signs are a direct link to child abuse, however, I stand to remedy them. This might hold true in many cases, but not all cases. I won't go directly into this subject, because I will be writing a book specifically discussing serial killers later on, however I wanted to point this problem out considering that sexual conditions are in fact psychological. There has actually been proof that link impairments in the brain that are causing the disturbances. The mind is a difficult thing, and up until humankind is able to comprehend the mind entirely and begin accepting some realities, we are going to continue handling mental health and mental illnesses with little outcomes. Again, I will be attending to these concerns in later copies, but for now, we require a rundown to see where psychological health is heading. Dementia and delirium are mind disorders in the sense the impairment triggers amnesia, confusion, and is extremely typical in the older generation of people. The diagnosis can puzzle specialists if the client is more youthful, given the downsides. Diagnosis: other medical diagnosis has comparables such as alcoholism and drug conditions. Typically triggers mental blackouts, along with other signs. Although this is noted under mental health, I stand to correct them when they call the disability a condition. Alcoholism and drugs is typically connected to genetic and is thought about a disease. Alcohol and drugs immediately impact the mind to a degree, but it totally depends on the status of the mind prior to drugs or alcohol ended up being a concern. Often alcohol addiction and drug dependencies are straight connected to mental disorders. This implies that there is a problem under the surface, and the client typically utilizes alcohol or drugs to cover the ailment. There are numerous questions we ought to ask mental health specialists to understand our diagnoses. Questions to ask mental health experts. If you or someone you enjoy sees a therapist, there are questions you require to ask to prevent issues. Some therapists are more advanced than others are, and after 24 of strolling in and out the door of mental health workplaces, I can inform you that some are not certified to detect anything that is not typical. If you suspect you have a condition, the best thing you can do is get precision on those signs, research your behaviors, and write them down. If you go to the therapist, you will be ahead of the video game, and by discovering more about your own habits, signs, etc. can save you from a diagnosis you might or may not have. Therapist as a general guideline base there on the thought patterns, that includes hearing and talking. If the client reveals a disruption in their thinking patterns, the therapist will think about psychosis, since this is a symptom related to the diagnosis. Therapists will look for indications that the patient might show, consisting of unclear ideas, fleeting concepts, peripheral thought patterns, obstructing thoughts, disassociation, etc. Counselors typically search for proof of schizophrenia or psychosis when there is a break in truth, paranoia, and so forth. Paranoid and paranoia are different from the other, and need to not be misconstrued. Specialists might slip up in medical diagnosis if they are not knowledgeable about the difference of paranoia and paranoid. Schizophrenias are frequently paranoid, while patients that suffer post-traumatic stress in the early stages may highlight paranoia. When a client responds too out of content, or else the ideas provided are unrelated to the conversation, then there is a potential mental disorder. For instance, we are talking about society, and the patient says, "I never ever go there. After I get back from Canada next week we can do that." And so on. Another area of concern is when the patient is talking fragments, rather than delivering a complete sentence. Normally the patient will begin with one concept and dive repeatedly to a number of other ideas. This pattern is called short-lived thought processing. When the client is showing thoughts that are sidetracked, the therapist might reveal a degree of concern. Stop here. Language is necessary when examining a patient. Given that some patients might not have enough abilities in communication, it might extremely well suggest a lack of education instead of a medical diagnosis. If you are checking out a therapist, or have taken another individual to a therapist, and this is the only symptom, make certain that the patient is not wrongly detected and placed on medications she or he might not need. It is necessary to take note of signs that link mental health. Make certain to ask the therapist concerns at any time there is a medical diagnosis. Never ever accept the diagnosis without finding out more about it, what the signs consist of, and what medications can do to deal with the condition. When a person is unexpectedly lose a train of thought during a session, this might be a possible medical diagnosis. For instance, if an individual is telling you about a dream related to his parent, and all of an unexpected claims they cannot remember what they were discussing, this is an apparent indication of disorder. Probably, this patient has actually suffered trauma. The signs are in front of you and it is essential to continue treatment to discover which medical diagnosis the patient may have. Unfortunately, most therapists are not trained to treat patients with multiple personality disorders, and typically these individuals pay a steep rate for carelessness and ignorance. The indication or sign is referred to as dissociation or blocking memories, and this is a definite sign or multiple personality disorder. It is important to examine the patient however closely, since dementia and other types of disorders may cause slight dissociation. Multiple personality disorder is often exclusive in blocking memories to avoid pain. Therapists are constantly studying the mind and often use the guinea pig method until they figure out what the problem is. It is always wise to ask questions when you are visiting any therapist, since many make mistakes and your mental health or someone else's mental health is important and should not be taken lightly. Having a healthy mind is important to survival. Mental health symptoms are serious and should never be taken lightly. Symptoms of mental illness. All diagnoses have varying degrees of symptoms, and even while certain symptoms may resemble those of another prognosis, they shouldn't be confounded. Before making a diagnosis, it is crucial to thoroughly examine the patient. Since depression is currently one of the most prevalent diagnoses, let's look at it. Major depressive episodes, dysthymic and bipolar manic depression, cyclothymic and premenstrual dysthymic are only a few of the several types of depression. Mood swings are frequent signs of depression diagnosis. Since most diagnoses are connected, a thorough physical examination of the patient is crucial for an accurate diagnosis. Most of us experience normal mood fluctuations, but mania is characterized by elevated moods in a patient. Major depressive episodes frequently experience a sense of suffocation. Antidepressants are frequently used to treat major depression episodes, which are also referred to as unipolar. Biologic imbalances, pessimistic outlooks, genetics, inability to cope with stressor, chemical imbalances, personality faults, and other factors have all been related to major depressive episodes. The diagnosis cannot be explained by a single cause, and as of this writing, the prognosis is still being researched. Since antidepressants are frequently used to treat patients, it is rare for individuals to fully recover because research has shown that these medications are harmful. Similar to many other forms of depression, major depressive episodes frequently have symptoms like melancholy, pessimism, suicide thoughts, loss of interest, feelings of hopelessness, and so on. The patients are frequently biologically affected, resulting in symptoms like symptoms are weariness, nausea, headaches, and so on. If severe, the patient may even exhibit delusional behaviors or hallucinate. Note, psychosis and schizophrenia have many of the same symptoms with other diagnoses, thus it is crucial to do a comprehensive physical examination before beginning treatment. While delusional behaviors or hallucinations are common in people with schizophrenia, they are less severe and more infrequent in those who have depression. When someone is displaying signs of sadness, it's crucial to take them to the doctor for a complete evaluation. The majority of the time, these people's medical conditions are what's causing their depressive behaviors. The patient may not need psychological counseling if you treat them physically. To avoid more sorrow, take precautions before addiction. Symptoms of bipolar developing a disorder, also long-term drug known as manic depression, include mania, altered speech patterns, exhaustion or else a difficulty to fall asleep, regularly being overly or underly enthusiastic, and so forth. According to therapists, at least 75% of bipolar individuals have delusions or hallucinations. Many bipolar individuals treat or act on suicide impulses frequently. Additionally, they frequently threaten or assault those in their immediate vicinity. Studies have demonstrated a hereditary component to bipolar disorder. Therapists should do a thorough examination of the patient to rule out cyclothymic disorder as well as other conditions including schizophrenia and psychosis. It is thought that cyclothymic disorder is a milder version of bipolar illness. Many cyclothymic sufferers experience hypomania or mood fluctuations. Since the diagnosis is less serious than bipolar disorder, the symptoms are distinct. PMDD, premenstrual dysphoric disorder, is linked to hormones. Women who are menstruating frequently experience stress or despair during this time. Although there had previously been disagreements over this diagnostic, it was incorporated to the DSM-IIIR in the early 1990s. Dietary changes, feelings of overwhelm, irritability, irrational thought, headaches, cramping, bloating, and other symptoms are among the symptoms. Since individuals who have been abused experience similar symptoms, this diagnosis is susceptible to error. Patients with PMDD are frequently treated by doctors with hormone treatment. These medications have a poor safety record and frequently don't help with difficulties. Researchers have discovered that administering medications to those who are mentally ill makes things worse. Not all medications are terrible, but if a patient is taking them, the professionals have a responsibility to regularly monitor the patient and look at their symptoms and indicators. If the patient displays any side effects, the medication should be changed or the dosage adjusted. Again, there are various levels of symptoms as well as symptoms that are identical in a small number receiving treatment for a mental of diagnoses, therefore anyone. Disease should be thoroughly assessed before a future diagnosis is made. A sound mind helps us stay on course. Stress and anxiety are two frequent signs of mental health that might start with hallucinations and delusions. Delusions to hallucinations, mental wellness. Since there are so many different sorts of diagnoses, such as personality disorders, cognitive disorders, mental ailments, and so on, mental health can be challenging. Although it is practically difficult to fully grasp mental health, there are many solutions to the questions that many people have because we are all either directly or indirectly impacted by mental illnesses. A person may have hallucinations or develop delusions as a cognitive deficiencies. Result of certain conditions. Less severe symptoms could diseases, or indicator. Different disease. Patients with anxiety disorders, for instance, may worry excessively, experience sleep problems, difficulty concentrating, tension attacks, emotional anguish, headaches, and other symptoms. Anorexia, phobias of social situations, obsessive-compulsive behavior, hypochondria, and other severe symptoms are some of this disorder's most prominent signs. Adjustment disorders, depersonalization disorder, and other disorders are frequently associated to anxiety disorders. Some researchers and philosophers disagree with the idea that anxiety disorders have a direct genetic component. Typically, a series of failures, losses, etc. trigger anxiety. If the patient is unable to cope with everyday stressor, this can have an impact on the neurological system and lead to repeated anxiety episodes. Other symptoms frequently appear after an anxiety attack because the person is somewhat disassociated from reality. In that both anxiety disorder and panic disorder have comparable symptoms, they are similar. Patients with panic disorders frequently experience severe panic attacks, as well as sadness, agoraphobia, and other related issues. Suicidal thoughts or impulses, obsessive and compulsive behaviors, substance misuse, cardiac problems, and other connected problems are among of this disorder's most severe symptoms. Physical impairments can occur in anyone who has panic or anxiety disorders. Many males around the world suffer from social phobias, which have also impacted kids and women. These people frequently worry about seeming foolish and avoid social situations since their anxieties can result in panic episodes. Most patients with social phobias fail because they struggle with social interactions at work, have problems shopping, etc. Each of the conditions included in this article has an impact on the patient's physical and mental health, and in some cases, patients have passed away from heart attacks as a result of their inability to cope. People who worry excessively frequently put their hearts at peril. In order to avoid further difficulties, it is essential to manage these kinds of disorders. I can speak from personal experience when I say that post-traumatic stress disorder (PTSD) is a difficult and stressful condition. Trauma, rape, violence, terrorist attacks, and other forms of calamities can all lead to post-traumatic stress disorder. In this instance, frequent flashbacks cause the patient to again relive the trauma. Before professionals started assessing it, the disease was referred to as battle shock. The patient frequently experiences recurrent nightmares, night sweats, and dislikes loud noises like popping noises since they frequently resemble cannons firing. The majority of PTSD patients isolate themselves from society since so many people around the globe frequently express concern for the diseases, which frequently triggers the sufferer. Their senses, thoughts, and emotions are frequently numbed, and patients frequently lose their concentration. They frequently have trouble falling asleep, and they pay close attention to their environment. Some post-traumatic stress disorder sufferers exhibit severe outbursts when provoked, therefore it's crucial to treat them carefully and like a dedicated flower. They frequently experience depressive episodes as well as severe stress, panic attacks, dissociation, and other symptoms. Although every person is unique, some post-traumatic stress disorder sufferers may even display suicidal or even explosive tendencies. It is crucial to properly assess the person because post-traumatic symptoms are linked to many other forms of diseases. Post-traumatic patients frequently struggle to understand what other people are saying when they communicate. Many people with post-traumatic stress disorder turn to alcohol to ease their suffering. As a result, the diagnosis is just made more severe, and the patient's recuperation is regressing. There are many degrees of post-traumatic stress disorder, with some cases being more severe than others. Since post-traumatic stress disorder frequently results from traumatic situations, whether a person witnesses a violent crime, is assaulted, or what have you, it affects people of various ages, genders, nations, classes, and other categories. The patient's amnesia should then be assessed to see if it is psychogenic or dissociative. Mental health: psychogenic and dissociative amnesia. You might be wondering, what in the world is this now? Patients with psychogenic and dissociative amnesia are unable to recall details from their history. The majority of individuals who experience psychogenic or dissociative amnesia have experienced trauma in the past, such as rape, natural catastrophes, overwhelming situations, and so forth. Psychosocial stress affects most patients. Amnesia is the only sign of this illness. The patient frequently has trouble recalling or remembering recent events as well as occasionally recent occurrences. This illness is easily identifiable, and it shouldn't be mistaken for multiple personality disorders. Symptoms of multiple personality disorder are far more intricate than those of psychogenic amnesia or dissociative amnesia. Since the sensation of memory loss is frequently overwhelming, many individuals with psychogenic or dissociative amnesia may experience sadness. Another classification of amnesiac condition is psychogenic or dissociative fugue. These patients occasionally disappear for a brief period of time and frequently forget where they were or why they went. The majority of patients with this diagnosis have endured traumatic events. Dissociation is a common feature of depersonalization disorders, however in this case the person runs away from reality and into an unreal condition. They may show actions such as dream states of consciousness and occasional distortion. Additionally, they could experience despair, fainting spells, panic attacks, and other similar symptoms. While the listed problems are frequently simpler to treat than the more difficult diagnoses, some of the most complex mental health disorders are constantly under review. However, as forgetfulness can lead to additional issues, the diagnoses must be treated, just like with many patients. For instance, if a person has trouble remembering, others might take advantage of them. This exposes children to misery and pain from outside sources. It is crucial to protect the patient by receiving assistance because if they wander off, they could be hurt by others. The majority of people with these disorders respond well to treatment, and because the symptoms are so mild, any therapist should be able to identify the illness immediately away. Psychogenic or dissociative fugue or amnesia has specific features as opposed to multiple personality disorder, when the patient alters personalities. The fact that these people are uncommon would be the only challenge for therapists in making the diagnosis. Disorders of amnesia are frequently brought on by epilepsy, brain traumas, strokes, and other medical conditions. Use of alcohol and other substances has also been linked to psychogenic or dissociative symptoms. Since no two persons are alike, a patient's symptoms may differ slightly from those of another patient. The therapist may have trouble identifying the signs of forgetfulness disorder if these patients have multiple diagnoses. It is difficult to diagnose any ailment, including cognitive disorders, diseases of the mind, and so on, but certain diagnoses are much harder to make than others. As a result, it's critical to identify a specialist who can assist the patient in getting better if you notice anyone exhibiting symptoms or indicators of a mental illness. Professionals who handle standard diagnoses will frequently be able to predict where they are going and may start therapy right away, which will assist the patient cope with their misery. Another diagnosis that affects people on a daily basis is fatigue. Although fatigue is a sleep problem rather than a mental impairment, it needs to be treated before sleep deprives someone of their life. The majority of individuals with fatigue frequently experience melancholy, exhaustion, a lack of energy, headaches, joint and muscle aches, and other symptoms. This specific mental health problem has been investigated by scientists for years, but they have been unable to identify the reason of the stoppage. According to what I have observed, persons with tiredness syndrome frequently have underlying conditions, may have experienced physical illnesses, or alternatively are gravely depressed. Although every patient is different, most patients with fatigue syndrome struggle to function because it saps their vitality. It is best to visit your doctor if you suspect you have tiredness syndrome so they can rule out any physical issues. Your fatigue syndrome might easily go away if you have a condition that a doctor can cure right now. But what about mental health and sexual disorders? Sexual disorders and mental health. There are numerous varieties of sexual problems, consisting of pedophilia, sexual masochism, sadism, frotteurism, and so on. Many therapists discover treating sufferers with sexual ailment complicated when you consider that many elements are involved. Experts have connected sexual problems to biology, stress, emotional, body structure and so forth. While analyzing the conflicting problems, they decided that sexual problems need to be damaged into separate categories, and are frequently called sexual deviations. Taking a have-a-taker observes sexual masochism. The affected person frequently enjoys ache, indulges in sexual fantasy, enjoys humiliation, ropes, rape, abuse each emotional and physically, mutilation, and so forth. These varieties of sufferers are at extreme chance of harming the one's selves or others, and are frequently enduring signs and symptoms of depression, substance abuse, guilt, and so forth. Any affected person with sexual deviations is difficulty to inflicting ache on others, and regularly they development to greater intense popularity with inside the diagnoses. Hypoactive sexual preference ailment is contrary of sexual masochism. Instead of indulging in immoderate sexual sports regularly, the hypoactive will shun sexual touch. Patients affected by hypoactive sexual desire disorder are frequently hard to understand, and signs and symptoms consisting of depression, stress, and anxiety frequently save the affected person from recuperation quickly. Sexual sadism is every other shape of sexual deviation wherein the affected person indulges in sexual fantasies. Like the masochism kinds, the sadism will frequently bask in pornographic materials. Sadism additionally plain causing ache, consisting of burning, mutilation, torturing, beating and so forth. Again, that is a sexual deviation ailment, and if now no longer dealt with it may grow to be very risky. From preceding research and observations, I even have observed that those humans while they're now no longer launched from their sexual dreams will stalk, hunt, and try and reel a person into their web. If they're not able to discover or associate inclined to have interaction on this behavior, they frequently burst off right into a delusional nation of mind, and might in future grow to be fantastically risky in society. Many are ashamed in their manner of thinking, however not often deal with the issue. Often the sufferers are hostage to numerous fears, and in my experiences, I even have visible that supporting them to discover their fears is the supply for recuperation. When I do not forget sexual deviants, I think about Jeffrey Dahmer and numerous different acknowledged predators that tortured, killed, mutilated, and ate the frame parts. What are unwell individuals, but there are heaps of humans round the sector with sexual deviations that has now no longer long past to the extent Jeffrey has, and can also additionally now no longer, however it's miles essential to deal with them in case. Exhibitionism is greater of the display your penis kinds in public. Exhibitionism sufferers are frequently glad with the surprise expression in their victims, and may illustrate signs and symptoms consisting of low self-esteem. They will now no longer socialize and frequently display immaturity patterns. Pedophilia is every other sexual deviation that the affected person indulges in fantasy, and the movement of the affected person is typically launched on children. Pedophilia sufferers frequently go through insecurities and the want to dominate. In addition, they go through different associated issues. However, this kind should be evaluated and dealt with to forestall from harming others. Most pedophilia kinds not often forestall their sexual deviant behaviors. Frotteurism frequently want to touch. Often in public, they may find themselves in a place wherein they are able to break out after making touch with the victim. Symptoms frequently include incapacity to socialize, fear, shame, incapacity to say self, and so forth. Most frotteurism sufferers are frequently stuck in movement earlier than they may are trying to find out expert help. Anyone that suffers a sexual deviant will frequently into greater intense crook sports if they're now no longer stuck. The many rapists, consisting of serial rapists, frequently have a sexual deviant beneath the surface. Paraphilias are every other affected person that wishes on-the-spot mental treatment. The affected person frequently suffers urges, and is frequently stemmed from fantasy, illusion, and pornographic material, in addition to fear. Often the affected person will inflict ache, humiliation, and different dangerous procedures in the direction of the associate or victim. They frequently are excited through spanking, bondage, restraints, and whipping. There are many varieties of humans inside the global with exclusive varieties of intellectual illnesses. However, while someone has a sexual deviant underlying, then there may be continually a capability chance. Not all sexual deviants has killed, raped or abducted. However, it does now no longer imply that they may now no longer. There are many persona problems that require an explanation. Dangerous personality disorders explained. There are numerous kinds of character problems, and to apprehend every analysis you need to have an evidence in addition to a primary expertise disorder of every ailment. Starting with antisocial personality, which illustrates signs and symptoms which might be associated with many different problems, but separated because it has its personal tendencies. Antisocial character sorts regularly push aside others, and forget about legal guidelines set for the communities. Antisocial character sorts are regularly manipulative, conniving, and might coerce others into sharing awful behaviors. Often those kinds of people are past due for work, appointments, and seldom sense regret for his or her behaviors and actions. They experience dishonest whilst the opportune offers it, in addition to captivating others into believing their manner of thinking. Antisocial behaviors may also consist of rage, avoidance, impulsive behaviors, and so forth. Often delinquent behaviors begin at a younger age and development into adulthood. If you note a person is a compulsive liar, steals, disregards others, destroys different people's property, begins off-evolved fires, brings harms to animals and or humans, you then definitely discover a few assist now. Psychopathic tendencies and personalities are much like those precise diagnoses. Therefore, you could see how risky this character ailment is to others and to the patient. Antisocial personality disorders are regularly connected to abuse, alcoholism, drugs, crime, sexual deviations, and so forth. The ailment is determined to be hereditary, and can be connected to emotional dangers and parental guidance. However, this isn't always proper in all instances, due to the fact there are extra kids nowadays with delinquent behaviors. That's present-day classified beneath conduct control disorder, and there are numerous dad and mum competing to store their child's life. Antisocial personalities are regularly stated to go through a records of mind injury, and can be hereditary to own circle of relatives that suffers attention deficit hyperactivity disorder. It is critical that the people are seeking remedy as quickly as you note any symptoms or behaviors that pose a deal with to others. For the beyond 18 years, I dealt first-hand with this ailment and numerous different risky problems, and I can tell, even when you have to name the police to your child, do it. Another risky character ailment is borderline personality disorder (BPD), which includes signs and symptoms including impulsive behaviors, temper swings which might be regularly unpredictable, making the person an intense risky potential, frightened of abandonment, promiscuous behaviors, manipulative, self-destructive, on occasion violent, and so forth. It is feasible to deal with those people, however, it may be risky to stay with the sort of character kind. Borderline personalities regularly reduce themselves to a seeking attention, and regularly threaten suicide. They provide a love-hate relationship, and regularly are seeking comparable traits in different people. Other signs and symptoms consist of short time period psychotic breaks, illicit behaviors, denial, depression, demanding, and so forth. Borderline personality disorder is connected to incest, emotional breakdowns inside families, alcoholism, drugs, and so forth, however now no longer continually. Histrionic personality disorder signs and symptoms regularly consist of vanity, narcissism, and anger, seductive, flirty, and so forth. Histrionic sorts regularly act, due to the fact they'll play the function of a sufferer in maximum circumstances. Histrionic character sorts may also produce other diagnoses, besides the signs and symptoms won't be intense. There had been instances suggested of histrionic character problems turning into extraordinarily violent, to the factor of murder. Obsessive-compulsive problems are regarded through their signs and symptoms, which consist of push-aside regulations, perfectionists, lack of ability for regulations and to finish maximum. Obligations, controlling with one sort of individual inclusive of lesser authority figures, and acts out strength of well-round authority figures to guard their identity, perspectives humans as objects, and so forth. The character kind is common, and those kinds of character attack maximum domestic violence victims. This isn't always continually proper, due to the fact different character sorts also are violent. Often the obsessive-compulsive sorts (OCD) have trouble finishing obligations because of their lack of ability to flex, and are regularly out to alienate everybody round them. These sorts also are very stingy and push aside others' emotions and feelings regularly. In fact, OCD sufferers may also abuse any round them that indicates feelings. It is critical to understand those signs and symptoms of the numerous kinds of character problems, now no longer simplest to shield yourself, however additionally to get assist for the ones which might be suffering. It is not clever to attempt to deal with those kinds of character problems to your personal in case you do now no longer have expertise. Most instances OCD sufferers, antisocial patients, and on occasion borderline personality patients have a severe appearance on their face in any respect instances. They regularly pressure themselves to giggle with inside the presence of others. Since all of the indexed character sorts push aside regulations, and people's emotions and feelings, it places everybody round them in intense danger. The majority of homicides suggested are outcomes from people with antisocial personality disorder, borderline personality disorder, histrionic personality disorder, OCD, despite the fact that the suggested OCD sufferers kill slowly, psychopathic, sociopath, schizophrenia, and different associated problems. Most all of the diagnoses specified in this text are very hard to deal with and in a few instances, not possible if the individual refuses assist. Moving on, we are able to speak multiple personality disorders and post-traumatic stress. Multiple personality disorder and post-traumatic stress. Multiple personality disorder and post-traumatic stress disorders are regularly related, on account that sufferers with MPD are seriously abused survivors in all instances as a rule. Multiple personality disorders regularly have signs, which includes awesome personalities, which includes exclusive genders, or ages, a couple of signatures, exclusive IQs, persona types, amnesia, voices with inside the head, common nightmares, the United States of we whilst relating to self, out-of-frame studies and so forth. The sufferers are regularly left on my own with inside the international on account that not often does the researchers, experts, philosophers and so forth have sufficient facts prepared to recognize this diagnosis. As a survivor of each multiple personality and post-traumatic stress disorder, I can let you know in maximum instances do you ever pay attention the reality in complete approximately a couple of persona issues. The distance among multiple personality disorders and different not unusual place issues is that MPD sufferers will combat in opposition to lying, try for accuracy, and implement precision. As a rule, maximum woman sufferers are not often violent, but there was regarded instances of male sufferers that had been dispatched to jail for rape, theft, and different crimes. The reality is the affected person turned into simply performing on a projection and interjection that turned into dispatched to him through every other alter. In different words, the affected person is reliving a bad second that possibly which includes rape, theft or different crimes, and acted out on his visible actions. This method that the affected person turned into questioning that he turned into fighting, or retaliating or reenacting what the offender did to him. I am now no longer writing many information about multiple personality disorder on account that I actually have an upcoming EE book occurring the marketplace. Any facts approximately multiple personality disorder may be furnished in extraordinary info in my EE book. I am afraid to shut my eyes, after I open them, I won't be me, the black demon. Multiple personality disorder is a real sickness without fictional characters, as many agree with. The personalities, which includes toddler alters, adult, teen, elderly, are all subcomponents of an virtually individual that turned into traumatized past or individuals' potential to deal with trauma. Multiple personality sufferers regularly go through anorexia and bulimia. They'll additionally be afflicted by snoozing issues and discomforts. Some of the personalities are more potent than others, and maximum all a couple of persona survivors are inventive and tremendously creative. Multiple personality sufferers also are intelligent. This analysis takes years to relieve, extraordinarily. And maximum therapists will keep away from diagnosing a affected person even supposing she or he has all the signs of a couple of persona sickness. Multiple persona sufferers additionally have problem with scientific treatment, because the blood costs boost and lower, MRI can locate seizures in the future and not anything the following, breathing costs regularly flounder, and a few alters may also be blind. The man or woman regularly is going via lifestyles with this sickness, and after they attain a positive age, shattering past coping begins. This is whilst integration wishes to take place. Integration is the processing of sending the alters to a place of the thoughts for everlasting stay. Once the integration manner is completed, maximum MPD sufferers are misplaced with inside the international. After dwelling a whole lifestyles with, families, within, after which abruptly getting into a corrupted device all on my own with little support, is it any surprise they regularly hate lifestyles after integration? The human beings regularly experience of loss whilst integrated, because the most effective own circle of relatives they knew and cherished is now sitting cushy with inside the chambers in their thoughts, at the same time as they ought to address all of the lying, stealing, controversies, work, and different lifestyle stressor on my own. The personalities as soon as integrated can nonetheless speak with the affected person, but it's miles by no means the same. Most MPD sufferers additionally have post-traumatic strain issues, on account that trauma from early adolescence and for the duration of their lives is the only cause MPD develops with inside the first place. There has been many arguments in this arguable sickness, however the reality is, it's miles actual and we should face the reality of its diagnose. The many controversies that has swept the marketplace is regularly related to criminals that use this diagnose as an excuse to break out with crime. Had the device been knowledgeable and customary MPD as an actual sickness, they wouldn't was so naive as to agree with simply every person claiming to have multiple personality disorder, and might have stopped the defendant on the front door. In the following heading we are able to talk impulsive behaviors in intellectual fitness that will help you see the hyperlinks among all issues. Impulsive behaviors in mental health. Impulse control disorders are not unusual place in youngsters today. There isn't always someone with inside the international that hasn't acted out impulsively, however while signs are reoccurring and consistent, you had higher get assist. Judgment performs a function in impulses, and if the judgment is unnoticed in risky situations, a person may want to get harm. Most sufferers with impulse managed behaviors frequently act out towards their higher judgment, and in lots of instances those behaviors has prompted damage to others. The character frequently does now no longer have the potential to treat the law, society, her or himself, in addition to others, seeing that as soon as the impulse hits the character frequently acts earlier than thinking. Often the affected person with sense an excessive feeling or inspired pressure earlier than performing out on impulse, and in maximum instances the affected person is not able to dismiss the herbal instincts that inform them no. In this article, we're going to peer into the minds of these who are suffering impulse-managed problems, with the aid of analyzing numerous diagnoses that consist of this interruption. Starting with intermittent explosive disorder, which if untreated is a deadly diagnose, surely due to the fact the character illustrates explosive behaviors. Patients with this sort of sickness frequently have neurological and mind aberrations, which frequently consist of intellectual ailments. Most sufferers with intermittent explosive behaviors are particularly risky and frequently have linking problems and intellectual ailments below the surface. For example, after managing a baby for 18 years, recognized with intermittent explosive disorders, impulsive control disorder, antisocial disorder, conduct control disorder, impulsive control disorder, oppositional defiance, feasible OCD, schizophrenia, and subsequently psychopathic tendencies, I can inform you that you could now no longer have assist available. Many human beings will now no longer address this sort of individual, which includes expert therapists, psychologists, psychiatrists, and so forth. In my case, I turned into advised, it turned into hereditary, and there has been no assist available. It turned into actual. Coming from the mouth of babes, the affected person himself stated, no counselor can assist. However, I located with the aid of using illustrating persistence, no fear of the affected person, beneficial tactics, opposite psychology, and different techniques proved valuable. This sort of affected person will abuse others nearly to the factor of demise is a few instances, bash your walls, bust up your windows, terrorize your home, harm your animals, begin fires and make explosives, interact in pornographic substances obsessively, snigger for no obvious reason, and stroll round maximum instances with a deranged appearance on their face. This is best the start of what takes place whilst you address this sort of diagnose. Most of the sufferers will explode in a rage of anger, wreck your material, and display no regret for his or her actions. The affected person might also additionally inform you the ones he blackouts at some stage in those episodes, which can be actual in a few instances. From experience, the affected person associated with me that he had an amazing aspect and an evil aspect and stated this repeatedly, and after searching into one set of the maximum devilish eyes imaginable, I am nevertheless investigating his words. The affected person is frequently brought on with the aid of using any other source, so in case you are managing this, watch what you say, do and so forth. Learn the affected person's triggers and keep away from them in any respect cost. I've visible this character get disappointed for no obvious reason, so it does happen, nevertheless keep away from hitting his or her triggers is wise. Impulse control disorders additionally consist of pathological gambling obsessions. This sort of interest is frequently uncontrollable because the character cannot manage his or her impulses as soon as dependency units in. In maximum instances, those kinds have underlying problems, which includes antisocial personalities, temper swings, alcohol, drug addictions, depression, feasible OCD and different problems. They frequently motel to crime due to their problems. Kleptomaniac frequently has impulsive behaviors, and cannot manage their actions. Pyromaniacs are any other sort of people which have issue controlling their impulses. These kinds take delight in putting fires and looking them burn, and could once in a while expand their extreme case and enlarge their hearthplace, putting practices past the comforts in their homes. Most pyromaniacs have troubles with substance abuse, self-esteem, lack of ability to stick to authority, and different associated signs. If you note a person sitting across the house, looking a lighter burn and guffawing, you would possibly need to pay nearer interest to this character. Some pyromaniacs display mild signs whilst others are extra extreme. Most mentally sick sufferers frequently go through sleep problems, which few have separate prognosis, titled somatoform. Somatoform mental disorders. What are somatoform mental disorders, you can ask? Somatoform disorders are illnesses of the thoughts in which the signs more often than not goal the sufferer's worry of ailment, clinical issues, frame, and so forth. Most somatoform sufferers proportion comparable trends consisting of bodily caution symptoms and symptoms without clarification and intellectual signs that insinuate that the bodily factors of the disease are associated with the mental styles of the thoughts. Somatoform sufferers are regularly tough to diagnose due to the fact that there are different associated signs in each bodily and intellectual regions that want explored also. Multiple sclerosis is one instance. This is carefully associated with somatoform disorders, but the signs modify in diverse regions. Most sufferers earlier than they were identified or believed to have somatoform need to difficulty his or herself to a chain of medicinal assessments finished earlier than the diagnosed somatoform is issued. Some signs of this form of disease can also additionally encompass clinical issues which could or won't exist, long-term records of now no longer being capable of feature emotionally, sociably, and so forth. Symptoms can also encompass inconsistencies and or doubtful lawsuits of psychical ailments, in addition to bodily signs that encompass nausea, diarrhea, joint aches, and so forth. Often the somatoform sufferers are interest-getters, and regularly abuse substances, even as they manage others, and rely on others commonly. Somatoform can also additionally or won't have extra problems consisting of histrionic and or delinquent problems. One instance of a somatoform disorder is the hypochondriasis. Often hypochondriasis suffers from worry which could encompass health. For instance, a hypochondriasis can also additionally continuously whinge approximately signs which could or won't exist, in addition to fear approximately ailments which could or won't occur. This form of affected person can also additionally fear approximately touch with sicknesses also. Note, this is why it's far tough to decide the diagnosis of somatoform without doing big study. OCD or obsessive-compulsive disease sufferers may also fear approximately sicknesses or contacting sicknesses and could time and again wash their hands, and regularly keep away from doing away with the trash. The obsession comes into play while the affected person refuses, or illustrates an intense worry in opposition to a few motion, and if pressured to so, the affected person can also additionally turn out to be aggressive, or maybe violent to keep away from the task. Compulsive is similar to obsessive nearly because the affected person will regularly compel in opposition to movements which could raise an ailment. One instance of somatoform may be visible as follows: the affected person is going to the health practitioner and argues irrespective of what the health practitioner says that no ailment is existing. The affected person can also additionally argue that the sicknesses are underdeveloped or assessments have now no longer been carried out to discover the ailment. Obviously, the health practitioner has finished each take a look at to be had and observed nothing. However, the affected person refuses to trust that her ailment does now no longer exist. Another form of somatoform is the body dysmorphic disorder (BDD), which includes tension and depression, in addition to OCD trends, and assumed clinical situations that regularly do now no longer exist. The affected person regularly will argue that the frame is malformed, and could regularly brush aside reassurance. This kind you can argue for hours with and by no means get anywhere. The maximum of those sorts of problems and new discoveries, and now no longer quite a few facts, is to be had to assist us apprehend the sufferers and the signs of the diagnoses. Scientist for years has observed new problems which might be stumping them every day. The pleasant answer for supporting those sorts of human beings is to get instant remedy due to the fact that maximum of those human beings have risky trends protected in somatoform. Antisocial, OCD and histrionic, and every of those diagnoses can also additionally encompass violent behaviors. Histrionics, antisocial and regularly over a direction of time OCD will kill if triggered. Therefore, the prognosis can be restricted with facts concerning the signs. However, if antisocial, OCD and histrionic are protected, collection research and assist are wished in treating those sufferers. Note, scientists declare finishing antisocial behaviors earlier than they begin can offer a healthful and strong surroundings for the affected person and family. However, conduct disorders earlier than antisocial disorders, known as the age of 18, are stated to be hereditary, which I trust, and over the primary idea and antisocial disorders most effective increase to lethal circumstances. Regardless of the signs, whether or not risky or now no longer, someone have to constantly get an assessment to decide the reason. Yet we need to. How does alcohol and drug abuse key into intellectual health, due to the fact that maximum sufferers identified are stated to be substance abusers? Alcohol and drug abuse in mental health. Alcohol abuse is overrated, even as drug abuse is underrated. The DSM guide indicates that substance abuse there are variations with inside the definition of drug and alcohol use. To confuse topics worse, the regulation has its very own model of who's an alcoholic or drug addict. Some of the signs and symptoms that assist specialists decide if alcohol and pills are a hassle include a moderate consuming, drugging, issues with the regulation, withdrawal signs and symptoms, shaking of the hands, and so forth. If someone liquids regular of the week and is predicated on alcohol, then you definitely are probable managing an alcoholic. There are philosophers who declare if someone desires a drink at breakfast, that she or he is an alcohol. Some philosophers declare that in case you drink greater than 6% weeks, then you definitely are an alcoholic. The truth is, maximum of the humans nagging or comparing alcohol and pills has a hassle themselves or has gotten assist a person of their lifetime to deal with their very own issues. Therefore, as you may see, addictions, dependent alcoholics, and different varieties of alcoholics and drug addicts may also alter. First all, any chemical that reasons damage is a capacity threat in your being. In different phrases, in case you start off consuming while you are 14 and retain through your lifetime without alcohol inflicting you trouble, otherwise touch down you a niche in prison, then you definitely are probable now no longer an alcoholic in keeping with few. The truth is those which are consuming and riding and getting stuck are alcoholics in keeping with the gadget, even though the extent of alcohol with inside the blood performs a function with inside the determination. The fact is the regulation now and again over dramatizes and the gadget is out to make all of the cash they can, so all of us is probably alcoholics by the point they may be finished with us. Alcoholism and drug addictions are complex. With inside the field there are too many misconstrued inputs and regularly the label is positioned on people in keeping with subculture and history. If your mother and father drank alcohol, then the gadget now and again will declare you as an alcoholic. The truth is, Jesus drink wine carefully, so consuming carefully isn't an awful thing. The hassle turns into a hassle while the character has trouble setting down the bottle and or will increase their consumption in addition to combining pills with the alcohol to get and have an effect on they became had. If a person will thieve or mislead get alcohol or pills, then you definitely understand they've a actual hassle. However, maximum alcoholics and drug addicts have larger issues than addictions, and that is regularly ignored. For example, humans with intellectual ailments regularly lodge to alcohol and or pills to discover alleviation in their signs and symptoms. Now if an expert is treating this character for their diagnosis and development is transferring alongside, the character regularly feels healthful and the alcohol and pills are out the door. In my research and opinions, I disagree with character is capable of alcoholism and drug addictions if the prevent as soon as the intellectual contamination is handled. This method that the character became struggling and the materials became a mechanism to assist them cope. On the alternative hand, if the character is handled for intellectual ailments and his or her drug and alcohol behavior retain, then I suppose you had high get out the chair and begin talking in the future at a time. Alcohol became as soon as referred to as the devil's drink. The white guys are the originator of the sauce, and on the grounds that it's starting it has brought on extreme complications, consisting of death, abuse, and different associated crimes. Drugs are elective for the reason that Gadget regularly makes them to be had with the aid of using coaching people what the medication contain. The root of all evil is cash, and if someone sees that he or she will be able to gain, they will take advantage, however fall right into a snare in between. The Gadget is overwrought, on the grounds that they placed alcoholics and pills addicts in prison and now no longer in search of assist for them. The way to humankind's hassle is supporting and now no longer hurting or promoting. If we can't get alongside now, what makes you suspect you'll heaven? Behind the partitions of the thoughts lies a fountain of bodily ailments. Behind the walls of the mind behind the partitions of the thoughts stands a totally complicated problem. This is inconsistent study. We have humans of all sorts, such as mentally ill, so known as ordinary minds, geniuses and so on. The thoughts has been recognized to play hints on us, allow us to down, pass to every other stage and so on. It appears with the warfare among the mind and self there may be in no way a prevailing ticket. The reality is the thoughts holds the important thing to all regions of your body, however the vital frightened device is the channel to the mind. In maximum times if the mind is affected is a right-away end result of the vital frightened device and spinal column. If the spinal column is out of line or injured then it's going to have an effect on the frightened device, which goes its manner in the direction of the mind. Once the mind is hit, the problems start and frequently do now no longer pretty till a person unearths out the supply of the hassle. There are many humans these days laid low with head injuries, disorders, cognitive disorders, illnesses of the thoughts, and so on. The issues boom because the years pass by. In my research, studies, case studies, and so on I determined that humans that visited chiropractors had been frequently more healthy than those who did now no longer. When a health practitioner specializes in the backbone, that's a right-away hyperlink to the mind, effects frequently occur. Scientists are frequently looking for answers to apprehend the specific intellectual ailments, illnesses and bodily impairments. They frequently run in each route and once in a while the solution is mendacity in the front of them. The hassle is anybody has opinions, theories, and guesses and a lot of them are ignoring the voices that name out with know-how and experience. Recently there had been most important arguable problems concerning Medicaid and chiropractor offerings. For a quick time, the chiropractors had been now no longer certified to take Medicaid patients, but many docs has dealt with a number of the identical humans and determined no solution to restore the numerous issues. While maximum humans consider that chiropractors paintings simplest with the bodily part of the body, they fail to spot that those specialists additionally paintings with the minds every day. Let's have a taker observe ADHD, ADD sufferers. In maximum times, part of the frightened device, backbone and mind is the main motive of the signs of this diagnosis. Most intellectual fitness specialists will provide the sufferer's drugs, which simplest covers the signs and is frequently inflicting different issues such as psychosis and schizophrenia signs. The mind, now if those humans had been treating the thoughts without drugs, and the usage of herbal herbs and spinal practices, what could happen? First, there could be no schizophrenia and psychosis-triggered sufferers, or at the least it'd be minimal. Let's examine bipolar. The affected person is frequently struggling as a right-away end result of chemical imbalances, and maximum intellectual fitness specialists will location the affected person on antidepressants, which ends up in strokes, coronary heart issues, early triggered adjustments of existence and so on. If a consultant that is aware of the backbone, frightened device and the mind dealt with the sufferers, what could happen? I for my part recognize a girl recognized with bipolar and he or she has sought out chiropractic aid and is doing wonderful overall, except her terrible behavior that she has illustrated for greater than 20 years. On the opposite hand, I recognize every other bipolar affected person that had no chiropractic offerings and he or she is a girl you need to live clean of. She known as me 18 instances consistent with day, threatened to dedicate suicide, and drove me truly nuts. I am nevertheless in recovery. Psychiatrists, therapists and personally, I went docs complaining of to psychologist. Signs that they concept had been connected to intellectual illness. After traveling a chiropractor, the signs reduced and I turned into capable of cope. Now, I am now no longer selling whatever here, however to apprehend the thoughts you need to do not forget the backbone, vital fright and device, mind and plenty of different elements earlier than coming to any conclusions. Some counselors will diagnose you as quickly as you stroll with inside the door. That is a terrible deal on the grounds that many frequently play towards a existence which will discover in solution. Once the expert sees that their diagnose is off balance, they frequently pass on to every other diagnose and sadly this is going on, and too regularly sufferers go through at wonderful lengths as a end result. Many humans with intellectual ailments frequently face sleepless nights. Disorders with inside the night. There's some distinctive varieties of sleep disorders that have an effect on hundreds of thousands across the globe. Sleepwalking, nightmares, insomnia, and sleep-wake problems can bring about distress if now no longer treated. All people have persevered nightmares or sleepless nights, however while the signs are persevering with its miles maximum in all likelihood the character has a sickness. The signs that come on my own with maximum sleep problems encompass pressure seeing that incapability to sleep, or sound asleep too much, in addition to nightmares reason grievance. Most sound asleep problems are connected to bodily ailments, mental stressor, different prognosis, alcohol, tablets, in addition to some different factors. Insomnia consists of dangerous signs that make someone have problem whilst looking to sleep, and regularly the character might also additionally awaken for the duration of sleep hours. This regularly ends in headaches for the duration of the waking hours for the reason that character is irritated. The sufferers regularly go through with the incapability to focus, depression, tension attacks, and no energy. Some sufferers might also additionally even be afflicted by bipolar, tension problems, or different varieties of problems. I persevered insomnia for the maximum a part of my existence due to different problems, however firsthand, I can let you know drug treatments may go for a few human beings, however for others it is able to now no longer. The answer I located that works fine for me, is consuming healthy, pressure the thoughts out of concept manner while you lay right all the way down to sleep, and maintain in thoughts, one day at a time. Insomnia sufferers regularly go through apprehension, or experience of loss, and trauma in addition to some different signs. Most insomnia disorders approach that someplace down the road the REM rapid eye movement sleep mode turned into confused. The trick then is getting the REM scheduler returned on course. During the REM sleep hours, the thoughts regularly goals, and the frame features regularly shift. For instance, your coronary heart charge might also additionally growth of lower in REM sleep mode. Since REM is regularly laid low with sound asleep hour schedules, it's miles every now and then viable to bear a sound asleep sickness. For instance, when you have a nighttime shift activity and later switch to day shift, it's miles apparent the REM mode is imbalanced. Once you discover a manner to get the thoughts on course again, it's miles viable to reinstate your intellectual health. However, when you have underlying problems, consisting of post-traumatic pressure, bipolar, more than one character sickness, and different problems, those diagnoses should be treated first earlier than remedy comes for the sound asleep sickness. Sleep-wake disorders or circadian rhythm sickness regularly growing sound asleep inefficiencies, consisting of sleepless nights, pressure, tension, jet lag and so on. This sickness is regularly resulting from modifications with inside the schedule. If the character does now no longer see the solar while she or he wakes clearly due to the fact they sleep all day from operating all night time, this can reason sleep-wake problems to develop. Sleepwalking disorders can end up deadly. Recent research have proven that sleepwalkers are able to homicide and could in no way recognize they killed. In my experiences, I do not forget short info of my sleep on foot nights, most effective due to the fact others that witnessed the movement gave me brilliant info. In one instant, I sat in a chair rocking backward and forward and humming, and in some other incident, I walked to the front of the residence and peered out the door, and grew to become and went returned to mattress whilst on foot beyond individuals of the family and in no way acknowledging them. I consider sounder sleep problems is associated with excessive stages of pressure, prognosis including post-traumatic stress, multiple personality disorder, and different problems had been trauma exists. At the time I underwent sleepwalking, I turned into beneath neither excessive degree of pressure, and suffered each multiple personality and post-traumatic stress. Most human beings that sleepwalk seem as 11 though they're in a zombie land. For instance, in case you word someone on foot beyond you at bedtime, and his or her face appears to have a clean stare otherwise a glance of unemotional status, then the character might be on foot in his or her sleep. Finally, nightmare problems are regularly connected to post-traumatic stress disorders, in addition to different problems, whilst there isn't always sufficient proof to be had to guide the claims. Trauma sufferers are regularly the human beings who are suffering with nightmares at some point of the night time. The character will see a real existence scene that depicts horror, fright, and so on, and every now and then will awaken screaming, and maximum all of the time bear nighttime sweats. Sometimes the goals are reoccurring and every now and then the goals alternate for the duration of the night time. Studies has currently proven that sleep problem sufferers might also additionally have bodily disabilities which might be connected to the sounder sleep problems, but nearly all sufferers recognized with sounder sleep problems have extra problems, suffered trauma, tablets or liquids excessively, and so on. Regardless of the problems, you should discover the supply earlier than you may deal with people with sounder sleep problems. Regardless of the incapacity, it's miles usually fine to have a situational control answer for every affected person separately. Situational management disabilities. Situational control in intellectual fitness is regarding sufferers correctly to discover the supply of the hassle, in addition to locating a strategy to restoration the hassle. Disabilities are available all forms, which include schizophrenia, post-traumatic strain, bipolar, depression, and a couple of persona and so on. When someone has an intellectual incapacity, we ought to continually searching for out the troubles that lay below the floor of the diagnose. Each incapacity has its very own specific signs, but may also encompass signs of different analysis. For example, post-traumatic stress disorder has signs which include flashbacks and nightmares. Likewise, multiple personality disorder (MPD), currently known as dissociate identities, sufferers frequently go through flashbacks and nightmares as well. Therefore, you ought to examine all signs of every diagnose earlier than concluding or deducing what we're dealing with. Schizophrenia is any other complex incapacity. Psychotics, schizophrenia and numerous different forms of diagnoses which include unique forms of schizophrenia frequently have comparable signs. For example, schizophrenias frequently hallucinate, and so will an affected person with psychosis. The distinction with inside the diagnose is that schizophrenias frequently have its very own signs, and are frequently extra full size than people with psychosis. We can see from this records then that we want a situational control answer, a good way to address every hassle with inside the diverse diagnoses. Looking at schizophrenia, the situational control need to be as follow. Schizophrenias need to routinely acquire medicines to save you, in addition headaches, which include harming self and others. Schizophrenias frequently want long-time period healing remedy, and control in their life. Often those human beings cannot discover a clear-up given that schizophrenia is frequently everlasting because of the lack of expertise at the complex cause of the incapacity. Psychotics are frequently tough to deal with as well, given that little records is to be had concerning the hassle. Psychotics are any other sort of incapacity that wishes long-time period remedy and medicines to keep away from, in addition headaches. When the two move unnoticed, the end result ought to show disastrous, because the signs are frequently a ability danger. Post-traumatic stress disorder is likewise complex, given that at one time the diagnose become best issued to battle survivors. Now research are proving that post-traumatic stress disorder is prolonged in addition than battle, and determined that many humans nowadays be afflicted by post-traumatic stress. Although the diagnose has its very own headaches, the therapist frequently has to take any other path to deal with those sufferers. They frequently encompass medicines, however once in a while should take a unique technique in remedy to deal with the sufferers. Since post-traumatic strain has unique levels, the situational control answer has to comply to the extent of post-traumatic strain. Multiple personality disorder (MPD) is an analysis in itself and isn't associated with strict intellectual infection. As a substitute, it's miles extra a neurological issue. Multiple personality sufferers are frequently brilliant, and really observant, in reality due to the fact amnesia will convey them to a far-off a part of the brain. Multiple personality disorder is complex with inside the field only a few recognize the complexity of the disorder. To deal with this sort of diagnosis, you'll want an instantaneous control with full-size skills. The character this is struggling with this incapacity is frequently simpler to deal with the one's not unusual place disabilities, in reality due to the fact the affected person will frequently post to the healing remedy, and the best time it will become extraordinarily risky is through the integration process. This is due to the fact the affected person will relive excessive trauma through projections and may come to be risky because the character would possibly damage his or herself. The projections are an real occasion that occurred that blanketed trauma, and the photographs are frequently real, primarily based, totally making it tough for the affected person to decipher. Often at this level, the character will modify and any other persona will take the spot. This diagnosis is any other long time period remedy, and medicines will frequently purpose extra damage than good. Bipolar is any other huge incapacity. This is affecting hundreds of thousands every day. This specific incapacity may be dealt reconstruct a specific chemical with drug treatments that this is absent from the brain. Regardless of what the incapacity is, the affected person ought to be dealt with enormously from different sufferers. Even if someone has bipolar, the signs aren't continually the equal in every case. For example, one character may also have suffered early life abuse, whilst any other has suffered the lack of her own circle of relatives member. Manifestly, the primary character may even want situational control that consists of trauma discount remedies. Understanding intellectual infection requires knowledge the undeveloped infant within. Mental illness in underdeveloped child separation. To recognize the numerous emotional breakdowns in our society, we should recognize how someone with their intellectual fitness has now no longer separated from his or her internal character at formative years. Many intellectual ailments and different issues in society are complex, surely due to the fact we do now no longer continually see the trouble which lies underneath the intellectual and bodily disabilities. Our baby inside will exist at some stage in our lifetime, and if we do now no longer apprehend this internal baby, we regularly go through emotional breakdowns. As a result, maximum experts battle to discover a manner to deal with sufferers with intellectual disabilities, but regularly fail to spot that the trouble is buried deep in the individual's thought structure. The baby that turned into ignored, emotionally neglected, probably abused physically, or witnessed many terrible disturbances, is buried underneath a shattering thoughts disease until the principal trouble is dealt with. The trouble will retain to grow. To touch the internal self, one has to have a simple information of his or her issues. Once a simple information is situated, the character can pass to the following step. Having a simple knowledge of you, incapacity can bring on rewards via way of means of assisting the affected person to simply accept his or her handicap. Emotional interruptions regularly stem from a lifelong formative years that has been ignored. Once the character involves his or her settlement with that baby of the beyond, it's far regularly simpler to assist the character pass ahead in recovery. After seeing what result in the intellectual infection, the character can discover a manner to cope with his or her signs better. Some diagnoses but are stemmed from mind injuries, chemical and bodily imbalances and so forth. While the underlying trouble exists, powerful remedy isn't feasible till a person offers with the organic issue of the trouble. For instance, schizophrenia turned into currently located to be a disorder of the thoughts due to the fact that twin holes have a bigger aspect to the hollow space of the mind organ. Other elements key into the knowledge of schizophrenia, inclusive of genetics. Many sufferers who are suffering with schizophrenia additionally had a disruptive formative years and regularly will deny this kind of happenings whether or not it's far proved or now no longer. The key then at the healing degree is to get the affected person to get in contact together along with his formative years and try to eliminate denial. As lengthy as a affected person is in denial, it's far greater complex to deal with him or her. Another instance may be visible with sufferers which can be identified with post-traumatic strain disease. Often those sufferers had been subjected to trauma as a baby and the disease escalated throughout a worrying experience. The answer then is to addressing the kid buried underneath the disease and shifting ahead to the worrying cause that placed the disease in excessive kingdom of thoughts. Once you dig deep into the formative years and assist the affected person to come to be familiar with the kid inside, then it's far feasible to deal with the affected person greater effectively. The trouble with many counselors is they fail to pay attention to the affected person. Often some accept as true with "I am the only retaining the diploma so I realize greater than you do." However, that is a long way from the truth. If greater human beings listened to the affected person, intellectual fitness could now no longer be as severe as it's far today. No possible realize greater approximately a circumstance than the only suffering. The first-class answer is to following a hard and fast of steps, beginning with listening and listening to what the affected person is telling you. If the affected person now no longer recognize his or her trouble, then you need to attain down deep within the affected person's baby and ask this character questions. After you attain the kid inside, then you may examine greater approximately the affected person. This will let you discover a method that would paintings first class for the affected person. Remember, anybody is specific and all people need to have his or her personal set of strategies. If you located that a healing method works for one character and now no longer another, you then definitely realize that there are variations that want on-the-spot attention. Taking it on a step and, in the future at a time, is likewise beneficial, and this method has labored wonders for plenty no matter what they're suffering. Trauma and mental health. Trauma is a end result of battering, witnesses a terrible assaults, enduring and twist of fate, incident, terrorist, and so on. Anytime someone is situation to violence, it brings forth trauma, whether or not it's far in small doses or severe doses. Post-traumatic stress disorders struggle fair shock changed into simplest related to combat. However, lately intellectual fitness specialists are locating that extra people a situation to post-traumatic stress disorder (PTSD). Generally, humans who suffer multiple personality disorder frequently have post-traumatic stress disorder underneath. It is frequently tough to come across this, considering that humans with multiple personality disorder alters or adjustments personalities. Some of the persona kinds won't illustrate any signs of intellectual illness, even as others might also additionally illustrate severe signs. Most sufferers with multiple personality disorder (MPD) had been situation to severe abuse as a child, because of this that those humans suffered intense trauma from the get-pass. Now, the humans that don't have multiple personality must go through stressful experiences, or witness stressful assaults. It relies upon it the thoughts. However, a few humans can witness and twist of fate and it won't faze them, even as others can witness a comparable twist of fate and it may lead them into PTSD signs. This sort of thoughts is frequently struggling with different problems, and the trouble has now no longer been detected, even as the person who changed into now no longer affected likely had superb coping skills. Most likely, the character affected survived traumas lengthy earlier than this twist of fate took place. Trauma impacts us all in a different way and a few extra than others. When someone endures trauma, it's far vital to get assist immediately, considering that trauma frequently performs with the thoughts. A character will frequently undergo sleepless nights, nightmares, tension and panic assaults and so forth. The troubles bring on extra headaches because the nerves are tortured and the character may motel to alcohol or capsules to alleviate the signs. Flashbacks are not unusual place with trauma sufferers, and flashbacks may be risky because the character loses touch with the right here and now. Rather, the affected person will pass returned in time to the occasion or one of the collection of activities that prompted the trauma, and that they frequently live caught there for a couple of minutes or longer. If a person is round them and that character does now no longer have expertise, different headaches can occur. Patients with post-traumatic stress disorders (PTSD) are frequently handled with diverse medications, inclusive of trazodone. Trazodone is frequently notable for easing pressure, lowering nighttime sweats, and nightmares, in addition to different signs of post-traumatic pressure. Another notable answer for trauma sufferers is to take natural herbs, inclusive of mental alert remedies, multiple vitamins, particularly saturated with B-complex, and so on. The herbal herbs are notable, and in case you are seated on a healthful food plan, this too is beneficial to lessen post-traumatic pressure signs. The extra you deal with the extra your signs will run the opposite way. Post-traumatic stress disorder is not anything to mess around with, because the signs are combat. In different words, while you undergo an attack, the character frequently seems like she or he is on a battlefield and everybody round them is the enemy. The signs go away, no room for concentration, expertise, or even have an effect on the character's capacity to pay attention what's stated to him or her. Post-traumatic stress disorder begins off evolved out with smaller signs and regularly works as much as deeper signs if now no longer handled. The sleepless nights on my own go away. The affected person. Open for triggers. Triggers are sound, smell, voices, taste, and so forth. There are many factors in society that may cause an episode of post-traumatic stress. It is likewise essential to reduce your amusement habits. If possible, keep away from films with the intention to startle, fright, or cause your signs. Movies which can be lively or comedies are notable reasserts of amusement with the intention to spare you a post-traumatic pressure attack. You need to take into account that once the worried machine is affected, then so is the frame and thoughts. In different words, the extra assaults you've got from post-traumatic pressure placed your coronary heart and frame susceptible to bodily illnesses. Finally, it's far essential to looking for assist, deal with yourself, and keep away from any detail in society with the intention to cause your signs, inclusive of humans if necessary. Isolation in a single shape isn't as awful as struggling post-traumatic pressure signs. Postpartum depression is every other trouble many suffer, but girls are the goal of this diagnose. Postpartum depression. Women around the world are resenting the day that our bodies will undergo a transformation. When postpartum despair kicks in, girls regularly sense sluggish, unconnected to reality, and regularly go through numerous different signs that consist of despair. Women that go through postpartum despair (PPD) regularly undergo bouts of crying uncontrollable, and really seldom do they recognize the cause. Their wondering is regularly irrational and their feelings are regularly tangled. One minute they're suffering to nod off and the subsequent minute they can't appear to wake up. Once a child is born, the own circle of relatives, friends, mum and so on are assumed to sign up for in a happy expedition. Sometimes moms undergo postpartum despair however, and the beginning appears greater like a curse than a joyous second. Instead of sharing a glad second, moms regularly sense an experience of guilt due to the fact they will resent the beginning in their child. All of a sudden, you start feeling sadness, despair, worthlessness, and insomnia kicks in. Then you undergo panic assaults even as feeling an experience of shame. In addition, it doesn't forestall there. Next you start feeling worry of losing manipulate of your actions, you begin feeling like your thoughts is tumbling, and your awareness has vanished. Still, you sense nausea, agitated, your coronary heart races, and also your respiration is complicated. The signs are growing as you sense an imbalanced stage of fear towards your child, hopelessness due to the fact you don't have any manipulate, exhausted from all of the intellectual modifications, and suicidal due to the fact you notice no manner out. The war is simply beginning. Mothers that be afflicted by postpartum despair regularly have an underlying mental impairment, feasible organic imbalances, which includes post-traumatic stress if the mum undergoes a terrible birthing. Most experts will deal with postpartum despair with antidepressants, combining it with remedy. It is vital for moms with postpartum despair to looking for assist immediately, because the diagnosis does now no longer handiest have an effect on the patient, it impacts everybody around you, which includes your child. Babies want their mum, and while the mum is not able to offer emotional nourishment and loving care, after which a child will go through because it grows into adulthood. Just like every diagnosis, there are triggers which could interrupt the mum, which includes tough births, separating oneself, death, modifications in dwelling arrangements, hereditary, monetary problems and so on. Unfortunately, a number of those triggers are going to happen. Most therapists have determined treating girls with postpartum despair, treating them with antidepressants and remedy has labored wonders. Recently research are locating that despair can also be dealt with electromagnetic remedy. Scientists are continuously attempting to find a strategy to deal with despair, so the quit of the sector hasn't arrived. There is hope. Studies have additionally proven that writing down your episodes, emotions and so on is a notable healing relief. Talking is likewise a notable supply for putting off stress, that is regularly connected to despair. It is vital to get ordinary checkups after your child is born to cast off organic reasoning for the postpartum despair. In maximum cases, medical doctors might also additionally prescribe Valiums, Prozac, or Zoloft. It relies upon the person, however for a few moms one or the alternative medicines work, even as others haven't any results. If you're struggling postpartum despair, it's also vital for the own circle of relatives to provide assist and understanding. Since you could have suicidal mind, the final factor all and sundry desires to do is push you over the edge. It is likewise vital that the resentment you sense isn't important towards your child. It may be which you resent a place of your life, or an incident and the child appears to be the target. You would possibly need to strive being attentive to clean song while you sense or experience of loss, or episodes of the diagnosis erupt. Music has established to heal the soul. In addition, you may need to begin exercise due to the fact this too has established to do wonders with human beings who are suffering intellectual or bodily illnesses. Exercise relieves the thoughts regularly due to the fact you're doing something to higher yourself and enhance your health. Therefore, in case you are in postpartum despair, there are solutions, and also you must by no means surrender hope. It is vital to find out how to narrate to sufferers with disabilities to assist them cope. Relating to others with disabilities. Relating to others with disabilities is regularly difficult. If you've got a intellectual contamination, the handiest reassets that apprehend you maximum instances with inside the intellectual fitness specialists, and from time to time they fail. I cannot anticipate 90 people's finger and feet. What number of sufferers advised me that intellectual fitness specialists have been now no longer assisting them. The sufferers have been complaining approximately the medicinal drugs and remedy they have been receiving. The trouble can also additionally have lain among the affected person and therapist, on the grounds that from time to time sufferers do now no longer do their exceptional to pay attention and comply with instructions. Other instances therapist does now no longer do their exceptional to pay attention and hear what the affected person is telling them. Regardless, something isn't always working, so we want to research powerful techniques that assist us to narrate to disabilities. Often while an affected person is complaining, there's a supply that cause that complaint. In a few instances have been the diagnosis is stricken by pretense positive issues purpose sufferers to whinge despite the fact that there aren't a trouble. Even as maximum disabilities there's a supply and motive for the complaint. Here is a part of the trouble. When the individual has a supply of complaint, they're regularly omitted in reality due to the fact they've intellectual contamination. You are exaggerating is regularly the sentence used while an intellectual unwell affected person complains. In maximum instances this isn't always true, on the grounds that intellectual unwell sufferers are regularly extra privy to their environment than the so-known as regular minds. Schizophrenias, psychotics, drug-caused issues, and some different varieties of intellectual ailments encompass signs and symptoms of hallucination, voices, delusions and illusions. The sufferers will whinge that their voices are telling them to do something, and despite the fact that that is a diploma of pretense or misunderstanding, it's far essential to pay attention because the affected person is situation to damage her or himself in addition to others round. When someone has an illusional nation of thoughts and voices out of doors the head, then there's no room for brushing off the affected person. However, while a affected person does now no longer have signs and symptoms indexed above, they regularly are vigilant, and might provide an explanation for what's taking place to them. One different trouble is the therapist or others across the affected person will regularly try to disconnect the affected person from his or her complaint. In different words, they may inform the affected person what the trouble is, and keep away from listening to what the affected person is telling them. Reading among the strains is the exceptional answer for verbal exchange and expertise, but maximum human beings study among their very own strains while speaking. I cannot strain the dangers this movement causes, on the grounds that verbal exchange is crucial for human beings to get alongside and apprehend one any other. Dialect regularly performs a position in failure of verbal exchange, on the grounds that we're all extraordinary and few folks can apprehend dialect. Therefore, one powerful approach of speaking and regarding disabilities is to understand maintain of dialect and discover ways to study among the strains of the sufferers. It is essential to preserve steady expertise techniques to assist the affected person deal with his or her signs and symptoms. Another exceptional approach is role play. Role play is exceptional because the affected person can appearance interior his or herself through a separate pair of eyes even as inspecting the purpose and movement of the trouble. Stepping out of doors of your very own thoughts lets you see among the strains, and allows the affected person to understand maintain of the answer in the front of them. For example, the affected person can be residing a dangerous way of life that triggers their signs and symptoms and is blind to their moves and behaviors. If the affected person consists of all factors of the trouble with inside the image and perspectives it with an open thoughts or any other eye, then the affected person will maximum probably see the purpose in their trouble. This approach is likewise powerful for assisting the affected person see who turned into part of their signs and symptoms, which include the individual can also additionally were abused which precipitated the people's signs and symptoms to a diploma. If that individual comes to just accept the trouble, then that affected person can flow ahead in existence successfully. Acceptance then is the opposite trouble we need to deal with to research and relate to disabilities, in addition to relate to all people round us. Understanding intellectual contamination can assist us to locate the solutions to the numerous issues round us. Understanding mental illness. Understanding intellectual contamination can assist us assist cherished ones get over their suffering. Although it isn't always viable to absolutely recognize seeing that even scientist is frequently baffled, it's far viable to have a simple knowledge. Understanding intellectual fitness and trauma also can assist us to analyze greater approximately intellectual illnesses. The trouble begins off evolved on the door with the intellectual fitness experts. They frequently start off diagnosing the affected person prematurely, and lay out a sequence of prognosis so that it will cast scientific value on coverage. The subsequent step is locating the prognosis that coverage will call if long time period remedy is needed. As you could see prematurely that, the affected person is already headed for extra issues, seeing that cash is the #1 problem in relation to intellectual fitness. The affected person is the final to recognize in lots of instances that she or he simply stepped into an internet of monetary problems and entrapment remedy. In different phrases the affected person might be recognized with Axis 1, depression, Axis 2, bipolar, Axis 3, physical issues, Axis IV, psychotic episodes, Axis V, suicidal with severe interrupted signs surrounding the cause. This is manifestly a severe criticism and coverage will frequently don't forget insurance because the affected person is a hazard. After their interview through an consumption therapist, they're frequently shifted to the subsequent stage, therapy. After the therapist evaluates the affected person sorting through the intake statistics and looking the affected person for symptoms or lines of signs related, the subsequent stage the therapist makes use of is diagnosing the affected person with an intellectual disease that complies with insurance. Most sufferers are recognized nicely but few are incorrectly recognized. The subsequent stage is traveling the psychiatrist who will then administer medicines to deal with the affected person. Seeing that extra money is concerned, they should recognize what Medicaid or different coverage policies will cover. The affected person is then issued to a therapist and a psychiatrist that believes they recognize greater than the affected person does. In regards to mental negative aspects that is true, but if the affected person become inclined to do a little studies she or he would possibly have greater a bonus over the experts seeing that they're informed. Once they recognize what signs are with inside the exclusive prognosis, they could then assist the counselor and medical doctor recognize greater approximately their suffering. The high-quality answer then is to investigate the diagnose that the therapist positioned on you to peer if that is what you're going through. Study the signs cautiously, hunting down any factors of the diagnose that won't contain you. After you've got weeded through the rumble, the subsequent step is sitting down together along with your therapist and permitting them to recognize which you took steps for your very own healing. You have evaluated the various diagnoses, which include the diagnoses the therapist issued, and located that there are factors lacking or there are factors of the diagnose that become overwrought. After you speak together along with your therapist the potentials or the factors of the diagnose that become misunderstood, you each can then paintings closer to attaining an universal view of what's genuinely pass on for your life. It is critical which you take notes when you have trouble staying focused, or in case you lack education, you may need to get a loved one that will help you with the studies, notes and discussing the trouble together along with your therapist. When we recognize what goes on, and what we're handling inside. This is part of knowledge. The trouble and the way it connects to the humans round you is in case you recognize what goes on inside your mind, after which you could give an explanation for this in your pals and cherished ones, assisting them to recognize. After we see wherein the trouble lies, we are able to then flow on to the subsequent step and begin accepting that there may be a trouble. Dealing with the issues is your subsequent step, which takes knowledge. If you do now no longer have knowledge, then the trouble will simplest regress. Tell your family and pals which you are operating closer to remedy, and it'd be useful in the event that they do paintings with you that will help you discover a healing for your intellectual fitness issues. If there may be no healing, then they could paintings with you, knowledge that you may have signs erupt every now and then, and they may recognize which step to take to assisting you cope. Yet, we should examine leisure and the way it performs a function in intellectual fitness problems. Entertainment and mental health. Ironically, research have proven that positive sorts of films, tune and studying substances are related to intellectual ailments. For example, pornographic fabric has been tested to have an effect on people dramatically to the factor of murder, rape and different violent crimes. Such substances have an effect on even a person without intellectual ailments truly due to the fact a person falls sufferer to a predator alongside the path. Violent films and tune has additionally tested to have an effect on the mind. More and greater youngsters nowadays are violent, and research have proven that video games, films and tune play a huge position with inside the youngsters' behaviors. Studies has additionally proven that youngsters are committing murder, rape, taking drugs, alcohol, and interrupting others' people's existence as an end result from obsessive leisure behaviors. Although few argue that that is ludicrous, they don't have any concept what they're speaking about, because the ones arguing are the reasons which are generating such interrupting noises. Not goodbye. In the past, a younger guy claimed after listening Todd's song, "Kill Your Mother," endless of times, the lyrics went to his head and he acted out as a result to the song. This is handiest one account related to leisure and intellectual fitness. Mental fitness is not anything to toy with, and the policies had been laid out from the beginning. Even God mentioned and made it conscious to anybody that such behaviors could reason disaster. Proven devoted to his words, the phrase goes mad due to polluted behaviors created with the aid of using leisure. Do now no longer get me wrong, now no longer all leisure is awful. However, the fact is in case you are associating with awful, then awful will come to you and anybody round you due to the action. However, in case you are associating with good, then rewards are positive to follow. Not anybody with intellectual ailments but interact in wrongful behaviors, actions, or self-exposing themselves to leisure that harms. At least now no longer directly, however someplace of their lifetime they had been uncovered in a roundabout way to this sort of behavior. I am promising you that everybody of their lifetime has been uncovered to this behavior, anybody with the exceptions of newborns. It is time we study what is going on round us to enhance intellectual fitness. We could be pounding our heads in opposition to the partitions for a lifetime if we do now no longer admit that dangerous leisure is a part of the hassle. Children study what they pay attention, see, and are taught. Likewise, adults study what they see, pay attention and are taught. No one is an exception the rule, and all people are topics to influences. Life is simply too brief to be gambling round with dangers. Either we're on this collectively or we're all running in the direction of a disastrous future. Satisfaction assured seeing that it's far displaying in all regions of existence. Take the terrorist assault in New York recently. What do you suspect related this intellectual disease to reality? While there are numerous reasons, the primary motive is the culprits had been uncovered to violence at some stage in their lifetime, and that is what they knew in keeping with what they saw, worked. In addition, it did to a degree. Somewhere down the road human beings had been communicating, but only a few had been listening. In any other case this will now no longer have show up with inside the first place. Somebody on this photograph became complaining and seeking to explicit their feelings and thoughts, but any individual on the alternative aspect became ignoring the cries. What it boils right all the way down to is how someone believes. If someone believes after being taught that violence is the solution to clear up a hassle, then violence is what you will see and anybody could be affected as a end result. You do now no longer mess around with faith, both you're with inside the race to win, otherwise you're on the street to death. Finally, we will see that leisure is nowadays greater graphic, and depicts inexplicit images on almost each channel, radio station, and so forth nowadays. It appears the morals and values are taking place the tube, even as the sector goes deeper and deeper into chaos and war. No you can restoration a hassle as quick because the hassle occurred, however someplace a person has to get began out to resolving what has already been done. How does sick minds assume alike? Ill minds suppose alike. Some humans accept as true with that intellectual ailments are all of the identical. If you're recognized with their intellectual contamination then now no longer to fear due to the fact all of us else recognized is similar to you. This is a ways eliminated from truth and the truth. What is so ironic is the identical humans which might be announcing this is frequently sick himself will frequently say something to the have an effect on while a homicide takes place. He is a psychopathic or sociopath. Yet the neighbor down the street who visits each day has her intellectual contamination, and while this character visits, or the therapist is overwrought. You do now no longer have her intellectual contamination, you've got troubles just like the relaxation of us. This is less complicated to simply accept than believing that someone has her intellectual contamination. This is nuts, considering that it's far simplest contributing to the trouble. The trouble with the arena is all of the humans searching for assisted doing their task and the humans which might be making excuses or in denial of intellectual fitness, contamination lifestyles is in severe want of assist. For instance, if Johnny visits a counselor understanding that something isn't always right, he's requesting assist. On the opposite hand, if that character sitting on the desk telling the neighbor not anything is wrong, and claims that seeing a counselor is simplest spending cash, then bet who's in actual want of assist. The character that doesn't visit a counselor or ask a person with inside the global for assistance is the person who mentally sick extra so than the not unusual place intellectual sick. Mental is not anything to mess around with, and considering that we're all one of a kind it could be complex to decide who's sick. I actually have watched as infinite of sufferers went to intellectual fitness specialists and watched them preserve to go through even though they labored difficult with the counselor to discover a clear up. The trouble is that intellectual health specialists are extra worried approximately cash than the sufferers are maximum time, and accept as true with they realize it all and the affected person is aware of not anything maximum all of the time. Many therapists are on this area of information, and in case you did a history test at the professional, you're likely going to look this character is a intellectual fitness capacity or pass out as well. It does now no longer take a genius to recognize intellectual fitness, however it takes many idiots to tangle the webs of darkness. In maximum instances, mentally sick sufferers are excellent people which have issue dealing with their lives because of common interruptions. Most all of the sufferers that visit intellectual fitness specialists can communicate approximately their troubles freely, looking for solutions to survive. The trouble is, among the traces of communication lies a fountain of statistics which can assist each the affected person and the counselor. However, too generally the advisors are entangled of their very own webs, they pass over out at the advantages of assisting every other character out. Personally, I spent 25 years in counselor and not using her effects up till the ultimate 3 years, after which I turned into running tougher than the counselor to clear up my very own troubles She turned into doing a part of her task, however my techniques had been succeeding hers and I left her behind. Now, in case you see what I am announcing, then you may recognize that everybody with their intellectual contamination has extra of a solution than over 1/2 of the experts with inside the global. If you've got enjoy and that they have a bit of paper without enjoy, who is aware of extra. I frequently have extra compassion for mentally sick sufferers than I actually have for the suffered to as ordinary and experts of the arena. I actually have watched many struggling after begging almost for assist, and little or no end result got here from it all. I watched as many counselors blame the affected person for the failure, however in all truths, that they'd a obligation on this as well. Most counselors are in denial that is a intellectual fitness issue, and plenty of humans in lots of professions are in denial, and this my pal is a first-rate purpose for intellectual fitness problems round the arena. Ill minds suppose alike due to the fact a person is stimulated whilst the opposite supply is influencing. A notable supply for gaining knowledge of an information is organization therapy. Group therapy. Group remedy has demonstrated to be powerful in intellectual fitness. While a few counselor will start off with one-on-one remedy, they will in the end refer the affected person to organization periods. Many offerings and aid businesses to be had provide assist to people with intellectual fitness troubles. Group remedy lets in the sufferers to freely talk their issues, troubles, or even locate social impacts that proportion the equal signs and symptoms or comparable signs and symptoms. When all greater human beings are collectively and might relate to every different, that is regularly greater powerful than one-on-one periods. Group remedy periods lets in the sufferers to fulfill a couple of times every week, assembly many others that proportion not unusual place ailments, for this reason selling association. If someone is struggling and has hard to fulfill in public places, or maybe move grocery buying, that is an incredible supply for restoration. Some human beings with intellectual ailments regularly keep away from socializing truly due to the fact they sense that different human beings do now no longer apprehend, and it's far embarrassing for them to head in public whilst they may be prone to erupting from their diagnose. Triggers are regularly what reason are intellectual sick character to go through interruptions, and oftentimes human beings care much less approximately what can also additionally cause every other character. It is critical to get assist if you have a intellectual contamination, but it's also critical to paintings via the troubles for your personal if feasible. If you operate self-communicate strategies, it could assist together along with your intellectual fitness issues. Another incredible shape of remedy is writing your troubles on paper. This is incredible, seeing that in case you positioned all of the info of your interruptions on paper, your counselor assist you to discover the reason and paintings in the direction of a resolve. Other incredible method for handling intellectual fitness is to keep away from isolation. This is in which organization remedy is available into play. Since you're round others, you may be capable of communicate. Communication is an first-rate supply for restoration. Another incredible supply for restoration is education. If you're in a set remedy session, you're coaching greater approximately you incapacity in addition to getting to know approximately how others go through comparable signs and symptoms as yourself. This prevents you from feeling alone. Group remedy is likewise incredible because it offers you the potential to get out of the house. Think of it as an pastime or a social unique experience. The leisure could be visible when you take a seat down, loosen up and begin sharing your troubles with others. Most human beings, while you inform them I am stricken by my diagnose, signs and symptoms together with the incapacity to concentrate, maximum human beings will say, oh, I apprehend this. I too have problems concentrating. Well, what do you do to make topics higher? You can also additionally ask. The different man or woman can also additionally let you know what she or he does to paintings in the direction of concentrating, and you can see someplace with inside the communicator method which can paintings for you. It turns into leisure because you discovered a supply of happiness within. Group remedy is incredible for lots individuals, however there are a few issues in which organization remedy have to be averted in any respect costs. Although counselors have installation organization conferences for such disabilities, it regularly proves tough in place of helpful. One instance is MPD sufferers, or multiple personality disorder. These sufferers are very awesome and feature triggers that interrupt the diagnosis greater so than different forms of intellectual ailments. Mental contamination is hard and regularly hard to apprehend, however in maximum all cases, there's a method to handling the diagnoses. It is critical to pay near interest in case you are becoming a member of a set session. When you pay interest, you acquire the advantages of listening to all approximately others and the way they go through too. You additionally get the advantage of feasible getting to know something approximately yourself. When you research who you're developing to development, that is the detail required for higher intellectual fitness. Finally, many who go through intellectual ailments regularly lack development. They're turned into something of their lifetime that turned into now no longer supplied to them to assist them grow. If someone is now developing according to human standards, then that man or woman regularly jumps tune someplace alongside the way. Mental fitness and organization periods then, is an incredible answer for developing. Education in intellectual fitness is every other incredible supply for information intellectual fitness. Education and mental health. When someone is affected by intellectual fitness issues, then the first-rate supply of help and assistance is discovered within the academic system. Many human beings that be afflicted by intellectual contamination are regularly within the stone a long time and do now no longer recognize what's to be had to them. They had been regularly misinformed at the same time as developing up, and considering schooling is continually advancing and changing, it's miles beneficial to realize what goes on. Of direction, when you have intellectual contamination you'll want to look a therapist. However, in case you are gaining knowledge of this will increase your probabilities of locating desire and keep away from being misinformed with the aid of using a person that isn't always qualified, or beneath qualified. Professionals round the sector are continuously attempting to find solutions to the numerous issues we are facing these days in intellectual fitness. The hassle is absolutely each person has a solution and maximum instances nobody agrees. They might locate a solution to the hassle, flip round, and slaughter with the aid of using studying the supply to death. Then we've got any other hassle, certainly due to the fact we've got dozens of diagnoses, consisting of schizophrenia, bipolar, depression, trauma, a number of issues and so forth. The special diagnoses are sicknesses of the thoughts, issues of the thoughts, and or chemical and organic interruptions. To get assist we need to realize what we're coping with, in preference to trusting in others to inform us what's wrong. If we are seeking for out facts concerning intellectual fitness we would even locate a solution to our very own hassle. We can then tell the expert and help him with locating an approach to the numerous issues we are facing. Mental fitness is complex certainly due to the fact we're coping with the thoughts. The thoughts is difficult and leaves us realize room for gambling round with contamination. Counseling is not anything greater than a not unusual place experience method laced with schooling. The experts are gaining knowledge of continuously new understandings at the same time as making use of them to the older versions. Somewhere within the center is a solution and its miles regularly disregarded whilst an expert will deal with numerous sufferers in the course of per week and from time to time attempt to deal with absolutely everybody the identical in the event that they have the identical diagnose. This is a hassle region considering are all special in our way, consisting of human beings with intellectual illnesses. For example, a counselor can also additionally deal with people each with schizophrenia. The counselor can also additionally use the identical processes with each sufferers and medicinal drugs for treating the affected person. One affected person can also additionally locate outcomes and the alternative affected person can also additionally whinge that the remedy isn't always working. Why is this happening? Well, it's miles apparent that one affected person can also additionally have a special degree of schizophrenia, and a special background. Some medicinal drugs paintings nicely with one affected person at the same time as it is able to now no longer paintings in any respect or paintings minimum with different sufferers. The answer then is re-evaluating the hassle and going over the stairs taking to deal with the affected person and editing them in keeping with the sufferer's wishes. It is crucial to understand a hassle to locate a technique appropriate for treating the hassle. It is likewise crucial to reconcile with the supply within. Meaning if a affected person has guilt it might be due to the fact she or he did something that could or can also additionally have now no longer been wrong. For example, if a discern taught the kid that touring their pals is wrong, schizophrenias will regularly discourage an infant from going to different human beings as domestic because of the paranoid, and the affected person, in the back of the mother and father back, went to go to a friend. The affected person manifestly wishes to understand that she or he did not anything wrong, alternatively she or he wishes to reconcile with self. In this case, the affected person will even want to be retaught to study proper and wrong. The affected person wishes to discover a resolve. After you've got help, the affected person triumph over this option. It's miles first rate to re-educate with cloth in preference to words. Simply put, if the affected person has a numerous of sources to select from, she or he has the potential to return back to their very own information of what's proper or what's wrong. Education is vital for reproving, reforming and teaching someone to the proper direction in life. Words also are crucial, considering in case you do now no longer recognize what's said, it's miles regularly due to loss of schooling. Yet we nonetheless want to study the practices in intellectual fitness to recognize what works first rate. Practices in mental health. What are the practices in intellectual fitness? Most human beings accept as true with that intellectual fitness professionals simply take a seat down and speak issues with sufferers. The reality is those professionals have greater to deal with than simply discussing issues. The professionals are accountable to preserve notes, compare the affected person's issues carefully, and discover an answer for what's inflicting the trouble. Mental fitness is by no means smooth, seeing that counselors regularly compare sufferers with all varieties of problems, illnesses and so on. Experts usually examine analysis along with schizophrenia, post-traumatic pressure disease, histrionic, antisocial, psychopathic, and so on each day. Since intellectual fitness has many regions of examine, it's far regularly tough to discover an answer. The many problems, illnesses of the thoughts, and different associated intellectual fitness problems are in consistent seek of growing techniques that paintings closer to a higher future. Looking at a number of the diagnoses can assist us to apprehend the practices in intellectual fitness. Let us start off mild and paintings our manner via a sequence of complicated intellectual illnesses. While there are numerous struggling with consuming problems and disconnections that trouble appear easy to repair, but it's far greater complicated than many realize. If someone has an consuming disease, it might be related to a early life wherein negligence got here into play. For example, the affected person can also additionally have grown up in a domestic wherein cash changed into tight. The mother and father can also additionally have struggled to preserve meals at the table, and regularly the kid ate one meal consistent with day. Later the kid changed into capable of consume food consistent with day, but this quantity reduced again. The trouble begins off evolved with nutrition. The affected person changed into malnutrition, which means that an ordinary consuming addiction changed into by no means developed. Now we've got installed a root of the trouble, we will see that intellectual will observe because the affected person in all likelihood feels or experience of resentment closer to the way of life she or he lived, and a number of that resentment is at the mother and father. Regardless of the attempt they or can also additionally have now no longer made to feed the children, it changed into their duty to discover a method to hold a healthful residing environment. Probably due to the fact this affected person changed into struggling malnutrition, the affected person changed into additionally go through inadequate emotional support. This is all grounds for consuming problems and disconnection to return back into focus. Now what if the affected person is anorexia or bulimic? What if the affected person has a deeper trouble than consuming problems? What if the affected person is placing his or her finger down her throat to throw up? Then we're searching at medical, intellectual, and consuming problems combined. As you may see, what appears a easy trouble becomes a rollercoaster experience for each the affected person and therapist. What approximately tension problems? So the man or woman receives disillusioned now and then. What is the trouble? All of us do this. First, we need to apprehend that tension disease isn't handiest pressure or shaking of the arms whilst disillusioned. Anxiety problems consist of signs along with phobia of public, emotions of despair, sadness, hysteria, coronary heart palpitations, sexual conflicts, and the listing is going on. Now we began out with what appeared to be a easy trouble, however after comparing a number of the signs we will see we're searching at a primary trouble that calls for vast evaluation. Panic disease is another, what appears to be easy to fix, analysis. However, panic disease like tension problems has complex signs, consisting of phobia, chest pain, respiratory difficulties, blackouts, and so on. We can see that the disease has ability dangers, seeing that each the frame and thoughts are affected. To deal with the disease we need to have a taker observe all elements of the sufferers, consisting of the signs. Not everybody with panic or tension problems go through the identical signs. In reality, a few sufferers go through much less than others do. Therefore, we do now no longer have a not unusual place flaw to face on. However, on the identical time, we've got not unusual place denominators that could direct us with inside the proper direction to resolve. Practices of intellectual fitness aren't as easy as many accept as true with. There is greater to intellectual fitness than Maximum realizes, and this consists of the human beings that examine intellectual fitness, seeing that they too are constantly looking for higher answers and answers. While we see that the practices vary, we additionally need to have a taker observe crook regulation and the way it too performs a position in intellectual fitness. Criminal minds in mental health. Why do humans visit jail? What prompted them to act this way? What makes them specific from all people else? We can hold asking questions on crooks' intellectual fitness status, however we're in no way going to locate a solution that fits us, in reality due to the fact there are too many ailments and few answers to repairing the ailments. In fact, a number of the reasons of crook behaviors are seated at the crook justice's doorstep. At the start of crook justice got here forth a group of so known as regulation enforcement organizations that declare to bring about justice. The twisted theories such as flogging, beating, hanging, dismembering, public humiliation, beheading, and the listing is going on and on. Therefore, we will see the basis of criminals begin with the crook justice machine. We all stimulated through a person else, and if our advanced examples are illustrating violence to others, what message are they sending to the international? In fact, the first recognized psychopath turned into recorded with inside the early 1800s. This character observed the instance of the justice machine through behaving in manners inappropriately. Howard owned his very own drug keep and labored round humans every day, saving lives even as taking different lives and destroying them. This is much like the justice machine method, because the regulation saves lives and takes lives. We also can check the diverse serial killers in our records and spot that those humans flogged, hung, beat, mutilated, public humiliated his victims, beheaded, dismembered and so forth. While every killer turned into specific from the different, in maximum instances every had their very own method to kill and torture every other human. The unhappy element is the regulation in those time-tortured people that dedicated much less than a felony. What are actual awful instance to follow, and these days the regulation remains in a few regions behaving on this manner. Rapists got here into play while the white supremacists have been allowed to rape the black race and break out with it. Although there has been rape instances earlier than this period, the white supremacists provoked unwell behaviors in others as they observed intently at the back of the footsteps. We can ask why do humans kill, and seldom locate a solution in view that we need to examine a mountain of records to discover what the hyperlinks absolutely are. We understand that humans go through intellectual ailments and a few are risky even as others aren't. We also can examine the crook justice machine and spot that the machine is a failure in lots of regions, and there are humans in jail which can be harmless or must now no longer be there at all. We can examine all of the examples in our records and spot that those humans are chargeable for a number of the behaviors and crimes that pass on with inside the international these days. We also can examine the numerous minds which can be locked up with inside the machine to decide why they do what they do. We also can examine society and spot the way it operates and what a part of obligation they've with inside the many crimes and criminals' actions. For instance, what element do you believe you studied racism performs in intellectual fitness and crime? Well, I am reading Crook Justice these days and I can inform you it performs a larger function than maximum humans believe. What element do the media play in intellectual fitness and crime? It too performs a big function. Poverty is every other most important hassle that hyperlinks crime and intellectual fitness or ailments together. When someone has no out, they regularly motel to crime, every now and then beginning small and unluckily maximum instances main to larger crimes. However, we additionally have the white-collar and blue-collar criminals. These humans aren't as unique as they believe, in view that many criminals labored crucial jobs, maintained a family, and socialized in society. In fact, among the serial killers did now no longer come from disadvantaged houses as claimed through the regulation. In fact, few got here from regulation-biding houses, and maximum instances the character struggling is struggling due to the fact is a baby born from a hereditary kingdom of chaos. We can ask all sorts of questions, however in a single article we may want to in no way some of the genuine colors, because the regulation, society, political, religions, records, intellectual ailments and so forth play an element in crime. The records of intellectual fitness and the regulation is continuously rotating and revolving. Mental health and history. There isn't always one unmarried second in our lifetimes that something has now no longer affected our intellectual fitness. We all touched via way of means of war, hate, prejudice, irrelevant materials, actions, effects and so forth. There isn't always one person in a global that has now no longer or will now no longer be stricken by a few act of violence, hate, etc. The hassle is how we deal with it and what sort of we paintings to take away the behaviors and effects from our lives. We all have a diploma of manipulate. We all can say we do now no longer need this conduct or effect in our lives and paintings difficult to terminate it permanently. If we're consuming or drugging closely, we're affecting out intellectual fitness and bodies. If we're obsessively worrying fitness, we all have. We're affecting out payments to pay, intellectual and bodily. Maximum people have youngsters to rise, and a number of us have extra issues that others simply do now no longer have. For example, the not unusual place man or woman struggles to pay payments, cope with the own circle of relatives and meet a person else's expectations. Some people but have to address signs including hallucinations, delusions, illusions, violent outbursts, temper swings, panic attacks, and so forth. It turned into now no longer sufficient that the sector is difficult that those people needed to be struck with an unexpected pressure that controls their lives each unmarried day, making it even greater tough than the common to continue to exist. We all ought to continue to exist distorted data in addition to discovered behaviors, and consequently this too makes it greater complex to address a further hassle and number of the human beings with inside the global address. You could suppose on account that those human beings have a incapacity and warfare tougher than others do, that human beings could be greater sympathizing. Instead, maximum human beings shun, poke or laugh at, mock, and upload greater issues to the intellectual sick patient's lifestyles than what she or he already has. Therefore, our records is usually including greater issues. The greater records comes ahead or movements backward, the greater examples, effects and behaviors are available focus. The cruel, ugly, harsh human beings with inside the global, coupled with the cruel ruling of the leaders of the sector, and sure via way of means of the fake teachings across the globe, were surely heading for destruction as opposed to recovery. Mental sick human beings are unique human beings that have been picked out from the rest, on account that those human beings have a message to narrate to others. Most sufferers with intellectual infection are exquisite and may let you know something you probably did now no longer realize in case you most effective allow them. Under the intellectual hassle lies someone struggling due to records, genetics, the criminal system, and the social environments. Underneath that devastated thoughts lies someone equipped to inform you what goes on if you'll most effective concentrate. This man or woman, if giving the danger to speak, will let you know greater approximately records than any book you'll ever read. This man or woman goes to inform you the way the effects in his lifetime surpassed on their ideals and behaviors to him. This man or woman goes to inform you that his ideals have been beaten on account that she or he turned into pressured to comply to different ideals in society and with inside the political and criminal system. This man or woman goes to put out a structural basis that turned into neglected and hid on the identical time. Everything a mentally sick man or woman has stated, is being observed someplace round the sector today. Even a paranoid schizophrenia stated something that many human beings laughed at, mocked, humiliated, and disconnecting her or him from reality. For example, paranoid schizophrenias are infamous for saying, "They're out to get me." The reality is, in case you pay attention, the man or woman isn't always lying, on account that we see it in our political global, our criminal global, or even in society. Every day the regulation is growing, they manipulate over society. Every day the political leaders are taking us right into a chaotic global, and ordinary society is killing, raping, torturing, and the listing is going on, but maximum human beings say it can't occur to me. The reality is, now no longer see you later. In the past terrorists did hit us all. Now do you spot in which they're coming to get you? They reached all of the manner over from throughout seas to try and smash America. Now in case you suppose you're higher than someone with intellectual ailments is, then you definitely higher step returned and take a better appearance and concentrate to the voices, due to the fact those human beings are you and I. Those human beings are part of our lives which are referring to a message, at the same time as calling out for help. Looking returned through the records of intellectual fitness and crime, we will see that despair is growing and despair kills. Depression kills. We pay attention reviews around the world of the numerous souls who suffer melancholy due to overwhelming pressure. With wars, poverty, and violence taking place round us, is it any marvel that melancholy is an issue? Statistics has demonstrated that melancholy hyperlinks to expanded coronary heart assaults and coronary heart ailment. Researchers have now no longer proved that melancholy is the reason of coronary heart ailment, however they do experience its far contribution. Depression is likewise the foundation for suicidal increase. Yet the deadly mistake that medical doctors make is over-medicating the affected person. Medications now no longer most effective suppress the trouble, however it contributes to scientific problems. The end result, the trouble remains there. Everyday research are locating new data but the data is frequently tossed to the backseat even as conventional remedies preserve. New research screen that during contrast, highbrow and in-depth, studies coupled with perception facilitates scientists apprehend melancholy. After observe the intellectual illness, intently they concluded in as soon as observe that melancholy is in all likelihood connected to current coronary heart illnesses which are end result of with untimely demise associated with coronary heart ailment resulting from untimely adjustments in ladies. In different phrases, postmenopausal problems have been stated to be connected. After cautious studies, it became proven that antidepressant capsules would possibly reason extra damage to patients. Observers that watched those ladies claimed that ladies have been at better hazard of coronary heart assaults even as inducing antidepressants. The Archives of Internal Medicines after undertaking surveys claimed that extra than 90,000 ladies over the age of 50 and out of 16% suffered essential melancholy. This become one half of the ladies and this one half have become taking antidepressants. The researchers persisted their research and determined that postmenopausal ladies suffered melancholy, and due to taking antidepressants, over one half of the ladies have been liable to demise associated with coronary heart illnesses. In 2003, new researchers concluded that the share of ladies at hazard could additionally be difficulty to fractured bones, and that extra than 8,000 ladies over 65 have been prescribed medicines and the drug treatments had affected the valuable frightened device. Researchers deduced that once taking prescription drugs for 5 years the ladies have been enormously displaying dangers of fracturing bones, and people that did now no longer take the medicine lived more healthy lives. After cautious research, researchers concluded that the prescription drugs have been the linking reason of psychical symptoms. In order to lessen melancholy, one should exercise, consume healthy, write in journals, and use self-prompted analytic profiling and assessment of self. It is extraordinarily crucial that someone come to apprehend their handicap and cope with it. More research have proven that after the backbone is out of alignment, or injured that it hyperlinks to melancholy, that is frequently resulting from pressure. Often while we go to our chiropractor, she will be able to assist us to get our backbone lower back in alignment, which has demonstrated to alleviate pressure and melancholy. In spite of the research that concluded that antidepressants may want a positioned or affected person at hazard, medical doctors around the world nonetheless take out their prescription pads and begin writing. Often the trouble is not noted and blame is positioned at the patients, even as the medical doctors preserve prescribing. Now you should ask the question, are you at hazard? If so, you want to take care which you discuss with the right physician. Ask him to display your problems cautiously and sway him far from prescribing antidepressants. Stay alert for your intellectual fitness and keep away from floundering, as this contributes to melancholy. There are answers to any issues as a way to paintings for you. Get out of the residence and socialize. Take up a recreation that you could enjoy. Read a rattling true EE book or write one yourself. Writing is a gift, an art, and a contribution to freedom of speech. Allow the phrases flow. As I analyzed this distraction, I concluded that melancholy is a masks a damaged recollection sponsored with hyperlinks to scientific problems fashioned and not noted. The spinal and frightened device are remarkably relative if now no longer constituting the primary reason of this distraction. What takes place is human beings who suffer fail to exercise, take a seat down straight, bend appropriately, and so forth. The end result, the backbone is dislocated. When the backbone is out of line, issues will arise. Depression can kill most effective in case you allow it. After reviewing melancholy, we are able to subsequent check tendencies in intellectual fitness. Mental health and traits. When human beings consider intellectual fitness, they intellectual disabilities or issues. However, intellectual consider ailments encompass trends, issues, character, dispositions and so forth. For example, psychopathic sufferers might also additionally have a character ailment, psychopathic dispositions or trends. The stage of ailment differs with inside the field. Trends are much less extreme than ailment and dispositions. Often human beings with those varieties of disabilities produce other diagnostic risks below the surface. Let's examine a affected person with psychopathic trends. This character is much less in all likelihood to kill than the character with inside the subsequent seat with psychopathic dispositions or character. Although the signs and symptoms are barely different, neither recognized affected person with those varieties of diagnoses ought to be excused from illustrating violent behaviors. In fact, now no longer all and sundry with psychopathic disabilities kill. Therefore, to recognize intellectual fitness and trends, you have to recognize the whole lot of the diagnoses. Traits are distinguishing characteristics of an unmarried diagnose. The trends might also additionally encompass comparable signs and symptoms illustrated with the aid of using a full-blown psychopathic, but now no longer as extreme. For example, psychopathic people frequently experience beginning fires. A affected person with psychopathic trends won't begin fires, however desire that they begin of doing so. These kinds will frequently consider the outcomes in advance of time, at the same time as psychopathic sufferers will now no longer. The disadvantage of psychopathic trends is if left untreated this character can damage off into dispositions and/or character issues. This means that threat is lurking closer. Psychopathic, like all and sundry else, has many aspects to their character, along with a bossy aspect, adventurous aspect, regular aspect, eccentric aspect, and so forth. Psychopathic sufferers can play as much as someone, and that character will see a pleasant aspect that leads him or she to accept as true with the character is a so known as regular. Yet whilst the character is going domestic, she or he engages in strange behaviors along with pornographic materials, obsessive music, and reading the regulation if you want to discover a loophole to escape with crime. This character would possibly even pass domestic and calculate a approach to damage the person that concept she or he turned into regular. What we're searching at then is a psychopathic man or woman with the trends main to dispositions to kill. We are searching at a character ailment. This is so entangled in an internet of illusionary questioning. Psychopathic frequently accept as true with and suppose in another way from the regular society. Some in their questioning is justifiable, however, their behaviors make it hard for others to listen. A psychopathic thinks killing will relieve his or her ache and suffering. That is manifestly an unjustifiable concept. However, if a psychopathic believes that the gadget is a failure, then she or he is heading in the right direction of their questioning, for the reason that records has proved his or her claims. According to information, there are 3 varieties of character issues which have urges to kill or damage different people. Scientist claims that 4% encompass antisocial personality disorder (APD), 1% psychopathic, and 3% sociopath. Now the not unusual place denominator that the 3 stocks is neither character kind, as now no longer have regards for different people's rights, nor do they display regret after they damage another. All 3 of those varieties of character frequently stroll round with a deranged appearance on their face, and all 3 are deadly. The distinction then isn't always all sociopaths kill, and frequently this kind of character has fewer signs and symptoms than a psychopathic character kind. While the information declare there's handiest 1% psychopathic with inside the world, the statistic are blown off the chart as greater of those character kinds gift themselves to society. Many of the psychopathic additionally have delinquent character issues, at the same time as delinquent character sufferers do now no longer constantly have psychopathic. However, they'll illustrate trends, for the reason that like psychopathic, delinquent signs and symptoms encompass hearthplace beginning, mattress wetting, damage to animals and human beings. As you could see, know how trends, character and dispositions, if important, for the reason that confusing one or the opposite can cause disaster. The drawback of the 3 index diagnoses is there's not often an answer for finishing the continuing intellectual ailments. This manner that remedy frequently does greater damage than good, and that maximum of the sufferers with those diagnoses are destined to crime. Studies are inconsistent hard work operating to locate answers, however the greater they seek, it appears with those diagnoses that the in addition that head backwards. The many illusions with inside the intellectual thoughts is frequently boggling, however all and sundry has hope. Mental illusions. Mental fitness has many illusions that it's miles regularly tough to type through the rumble. In intellectual fitness, we need to address bipolar on many degrees, panic issues, depression, trauma, and different greater tough analysis and signs. It is regularly tough on the grounds that while we have a taker observe the diverse intellectual ailments, we additionally need to appearance nearer on the underlying factors of the analysis. Underlying factors together with youth trauma performs a massive function in lots of diagnoses today. We additionally need to take into account the numerous factors which might be connected to intellectual fitness, inclusive of effects of the beyond and effects with inside the present-day times, inclusive of history, regulation, religion, and so on. All diagnoses, no matter the similarities, are dealt with differently, on the grounds that we're all different. Delusional issues, as an instance, require cautious interest for the reason that signs encompass separate factors and because it has a pair of various degrees of complexity. For instance, persecutory sorts undergo suspicious behaviors, which encompass believing that a person is out to get them, feeling of cheated in life, experience they may be mistreated, and could regularly encompass the regulation and justice device of their delusional behaviors. Delusional issues are tough surely due to the fact the affected person is regularly schizophrenic appearing, but all some of the traits and signs that schizophrenias illustrate. Some sufferers with delusional issues have a grandiose character, believing they may be higher than absolutely each person else is with inside the world. The affected person may also try and persuade every other character that she or he changed into cheated, mistreated, robbed, and might consider she or he has strength that nobody else has. Since minimum studies effects were furnished in this diagnosis, it's miles even greater tough to understand. Most delusional issues are classified through schizophrenia, however, it's miles hardly ever recognized as schizophrenia. We may also behavior a top-level view of cognitive issues and spot that even though they seem easy in form, they may be complicated. Delirium, as an instance, has signs inclusive of loss of awareness, brief anxiety spans, wandering communication, rambled speech, and so forth. The affected person regularly skips inside and outside of reality. To decide if the diagnosis is delirium, a counselor should rule out different opportunities inclusive of psychotic, dementia, schizophrenia, and different associated diagnoses. Other diagnoses together with histrionic character issues are even greater tough to address. Although the individual hardly ever suffers hallucination, they may be regularly phantasm of their manner of thinking. The individual regularly believes illustrates superficial traits in feelings, and turns into competitive, even violent if they may be now no longer the middle of focus. In different phrases, in case you aren't paying thorough interest to a histrionic, you had higher watch your back. Often histrionic sorts play a function appearing out a character that doesn't exist, and could shift moods regularly. If you notice someone giggling and wearing on 1 minute, after which turns violent, you is probably handling a histrionic character kind. Histrionic sorts are by no means the offender, they may be regularly the sufferer in line with their kingdom of thoughts. As you could see, you're handling a totally twisted thoughts here, and to take the individual gently is inquiring for not anything however trouble. Histrionic character sorts play many games, however while you are the sport player, there are potential risks involved. Histrionic sorts will cross at splendid lengths to show everybody wrong. Often those styles of people lack the capacity to expose feelings at our everyday kingdom. We also can peak on the narcissistic character issues. These humans are comparable in comparison to the histrionic with inside the feel they too are grandiose. They illustrate behaviors that encompass self-promoting, and regularly lack the capacity to treat others. Often this kind is demanding, and regularly has issue in relationships, on the grounds that each one is the awful guy. Looking at each histrionic and narcissistic personalities, we will see the similarities, which make it tough for absolutely each person. This is comparing the affected person. The expert comparing the affected person should additionally inclusive of borderline personality. Rule out different diagnoses. Disorder BPD, histrionic personality disorder, in addition to different underlying issues. The many intellectual ailments that we are facing each day are regularly tough, and while new research discover greater facts at the ailments, it will become even greater tough to understand. Who truly are the mentally impaired? The mentally impaired. The mentally impaired are suffering ordinary to continue to exist, a recreation of cat and mouse. Scientists are continuously arising with new answers, which they accept as true with is beneficial to treating among the intellectual infection. Scientists also are combating among themselves, one believing this and the opposition believing that. Is it any marvel mentally impaired is at the rise? At one factor, all of us felt just like the entire rattling global has long gone mad. At one factor in our life, all of us misplaced manage and acted out on our feelings and feelings. There are few human beings on earth that may say they by no means felt loopy at one time of their life. So, what separates us from the mentally impaired? The global is a loopy location to live, and all of us undergo loopy moments in our life. If you accept as true with that you haven't shared a second of insanity with a mentally unwell individual, you then definitely are deceptive yourself. In this article, we're going to appearance carefully with inside the thoughts of a mentally impaired person. Mentally impaired people regularly have a take or observe the sector otherwise from maximum human beings. They might also additionally experience that the sector is tumbling down on them. They may additionally experience that the sector is out to get them. In one manner, they're now no longer incorrect. The global is tumbling down in a sense. When we consider the wars round us, the terrorist attacks, the value of dwelling will increase and so forth, how is it that the sector is stable? If we examine the terrorist attacks, growth of regulation rule and regulations, political permit downs, and so on, how is it that the human beings of the sector aren't out to make our lives difficult? Evaluating sufferers is by no means an clean challenge really due to the fact sorting through their beliefs, manner of thinking, and phrases they strain we have to examine all angles carefully. Some sufferers go interruptions, temper swings, through panic attacks, tension, suspicion, illusions, delusions, hallucinations, and so on. Where are they coming from? How does one individual undergo voices of their head even as some other individual struggles with the voices out facet in their head? When a paranoid schizophrenia tells you that she or he suspects that the CIA KGB is out to get them, will we without a doubt realize wherein this got here from? Let us appearance nearer in the thoughts of a paranoid schizophrenia that regularly believes the CIA KGB human beings which can be busy with inside the larger global hunt her or him. Have you ever carried out something incorrect, whether or not it turned into unlawful or now no longer and were given away with it? If you've got what did you experience? You likely felt guilt, remorse, shame, and different associated feelings. If you probably did now no longer you then definitely may need to get your head checked. You might also additionally even undergo quick spans of paranoia. This is not unusual place while someone is incorrect. Now we will see that a paranoid schizophrenia likely did something incorrect in his or her lifetime and were given away with it. We also can see that the individual, in contrast to the bulk people that may address it, the affected person lets in the paranoia to take over completely. Most likely, a paranoid schizophrenia turned into taught incorrect, or listen to thoughts that lead her or him to accept as true with the manner they suppose and experience. They regularly lack conversation skills, and are regularly misinformed. Now if someone is in consistent perception of what she or he learned, thought, felt, and so on, it's simply way that the thoughts is scrambled like eggs and the shells are shattered. We additionally have to examine the reality that the twin in a paranoid schizophrenia's mind is odd in maximum instances. We have to additionally investigate the history and hereditary of the individual, considering that in maximum instances there may be syncytia records. One instance clarified this while a paranoid schizophrenia turned into studied carefully. It turned into determined that the mum had interruptive behaviors, along with violent outbursts, risky thinking, invalid beliefs, and so on. Many instances while we appearance lower back with inside the records of the affected person, we will see there may be a sample with inside the making. What separates us is that we're all person awesome from the opposite, and all of us have a records of intellectual infection someplace down the chain. Who are the deviants in intellectual health? The deviant in mental health. According to information, the deviant in intellectual fitness is usually the specialists when you consider that those humans are striving to put up their sufferers to the so-known as norms. The so-known as norms are stated to be humans that comply with a popular set of rules and regularly trust comparable in contrast. This method that everybody is every person else and fewer who they clearly are. Mental fitness is puffed up in lots of instances. For example, if a counselor believes one manner, he or she can be able to now no longer falter on the voices of the affected person's belief. If the affected person believes that she or he is bodily sick and the counselor see no proof of the claim, the expert will regularly take for gain that the affected person is sick. However, if the affected person is going to the doctor, assessments are run, after which who's the deviant. The sport of cat and mouse is usually performed in intellectual fitness and intellectual contamination when you consider that every person desires to be right. Is it any surprise intellectual ailments are growing and counselors are sitting of their snug chairs seeking to parent out what goes on? Anyone that is going to an intellectual fitness expert is nearly positive to obtain an immediate diagnose. The consumption employee on my own will examine an affected person looking for proof that complies with the insurance coverage. They will then deliver the affected person over to a therapist and likely onto a psychiatrist. The chain in no way ends. Too generally while sufferers go to a therapist, the expert will take for gain that she or he is knowledgeable and the affected person is a misfit. They regularly will talk, however listening is minimal. First, it takes years if now no longer an entire life to deal with a affected person with paranoid schizophrenia, and maximum instances the sufferers are protected with Medicaid, Medicare and disregarded at some stage in the path of treatment. Mental fitness specialists are in steady struggle attempting to find solutions to many questions. Today there are specialists admitting that taking note of the affected person is proving greater fruitful. It is time all of us have a take or observe the troubles taking place with inside the global and begin taking it greater serious, instead of brushing off the troubles. It is a disgrace that too many mentally sick sufferers are sitting in jail, actually due to the fact a person did now no longer concentrate and nobody did something in the direction of locating a resolve. Mental contamination as described is a sequence of minds that manufacture behaviors which can be remodeled copies of a social existence. According to studies, the behaviors of intellectual sick sufferers regularly infringe at the so-known as regular society. One of the maximum not unusual place trends in intellectual ailments consistent with specialists is denial. Here is wherein we stop. Denial and GT, mentally ill and GT, when a counselor makes a mistake in lots of instances they place the blame at the affected person or defective teachings. Few not often take duty for his or her wrong. Political and GT, when the leaders of the arena make errors they regularly seek the arena for a person else accountable. Religion and GT, when non-secular leaders are persecuted otherwise wrong, many discover a manner accountable the sufferers or applicants involved. When society makes errors, they regularly locate a person else accountable. When the regulation makes errors in maximum instances, it's usually a person else's fault. Denial, I assume you hire taking a deeper have a take or observe who's in denial, when you consider that sufferers sitting throughout from an expert inquiring for a sister admitting there may be a problem. There are many regions we are able to review, however the deviant isn't always usually sitting throughout the room searching into the eyes of a mentally sick person. We also can appearance nearer on the so-known as norms of society and notice they've their personal set of troubles. If all of us comply with a hard and fast of ideals that has established failure, what makes the person assume they're mentally stable? If humans are sitting down letting every person round them manage their lives and infrequently status up for his or her personal ideals, who says they're mentally stable? Mental ailments move deeper than many are aware, when you consider that almost every person with inside the global is struggling a few sort of unusual conduct copied from different behaviors. Someone else affects every person, therefore, all of us misplaced our values and morals someplace alongside the manner. Learning intellectual fitness secrets and techniques can assist us to higher recognized diagnoses. Mental health secrets. There are intellectual fitness secrets and techniques that everybody must understand, together with a way to save you misdiagnosing. Since cash is the difficulty in coverage, businesses play a function in remedy. Or affected person will regularly obtain a chain of diagnoses that comply with the requirements specified in fitness care coverage. This is best one region of troubles in intellectual fitness. The DMS manual copyrighted through APA, who brilliantly said that the guide became a manual to intellectual fitness, in place of claiming that the EE book became real, is some other region of concern. Therapists regularly base their diagnoses at the codes indexed on this guide. If the signs and symptoms healthy the sufferers, then that is what the affected person gets. Another region of trouble is while a affected person gets a diagnosis she or his, labeled, which brings forth extra troubles. Another region might also additionally sound ludicrous due to the fact we've got so known as experts with inside the field, however much like people with inside the international which might be stuck in a exercise of hobby for a brief time and twisted with an exaggerated zeal, craze fad, experts after they discover a diagnose of hobby which might be overzealous burning their wheels to supply greater cloth at the subject. Ever heard the saying, beating phrases down? Well, experts in intellectual fitness will regularly beat down diagnoses. While one of the problems in intellectual fitness revolves round labeling, I must disagree, due to the fact I sense the actual trouble stands among acceptances. If someone has a disorder of the thoughts, or a chemical imbalance, then accepting is step one in recovery. Some of the maximum helped human beings with inside the international attend alcoholic instructions, and the primary factor they apprehend is the trouble, which permits them to transport forward. There isn't always someone in his or her proper body of thoughts desires to recognize that they have got a chain of signs and symptoms and no cause at the back of it. It is good enough to mention I am a paranoid schizophrenia running towards recovery. It isn't always good enough to mention I am a misfit in society and can't recognize why I became selected for torture. As you could see, we've got a group of experts contributing to the trouble, due to the fact they're wondering they understand what's first class for the sufferers. Anyone this is struggling is aware of greater than any expert does, due to the fact they're those residing via the troubles. The sufferers can let you know higher than any counselor with a bit of paper and no revel in what they survive. Another region of trouble is many experts are from special nations and that they recognize diagnoses one manner or in some other term, whilst the American Psychiatrist Society relates in different terms. Professionals additionally accept as true with that sufferers will keep away from the problems, and or bury the actual troubles beneath. This isn't always usually true, for the reason that affected person is there with inside the first location asking assist to recognize his or her incapacity. If they knew the answers, they could now no longer be there with inside the first location. For example, Nikki is going to counseling explaining her many signs and symptoms, in addition to talks approximately the human beings round her which might be contributing to the trouble. She is attempting to manipulate her conduct, however others are making it tough due to the fact they middle her out, bringing forth the problems of her incapacity each unmarried day. First, we will see that others are a trouble, due to the fact many human beings will middle out people flaws first, earlier than complimenting. Therefore, that trouble may be resolved if we educate Nikki a way to handles different human beings round her. The subsequent difficulty is the signs and symptoms. What signs and symptoms do you've got Nikki? Nikki says I am having nighttime sweats, nightmares, flashbacks, impulsive outbursts, and so on. Well, why do you watch that is taking place Nikki? I do now no longer understand why it's miles taking place. First, Nikki is illustrating signs and symptoms of post-traumatic stress disorder, so it's miles obvious that she is a trauma-affected person. Therefore, Nikki is positive she became victimized, however unsure of the emotions, feelings, and notion method she is enduring. Now Nikki might also additionally or might not have the ability to inform you the whole occasion that introduced forth this disorder, however Nikki can let you know the environment of the occasion. This way the counselor desires to invoke communicate remedy to discover the underlying supply of her struggling. Does Nikki blame herself for the violence towards her, or the violence she witnessed? Probably so, due to the fact she is in a struggle of information the thoughts at her extra stage than the so-known as everyday minds and Nikki will struggle to locate the supply inside this is haunting her pricey soul and thoughts. The thoughts is a problematic factor, and to recognize it, you have to deal with it. We also can see how antidepressants play a function in intellectual fitness. Antidepressants in mental health. Since new research are proving that many antidepressants are related to coronary heart attacks, strokes, conduct troubles, and so forth, why are they nonetheless prescribing tablets? Why? Due to the fact they can't solution the lots of query approximately intellectual fitness, and they're not able to discover a answer in lots of instances to deal with every person intellectual contamination successful. Therapists are locating that being attentive to the sufferers and along with healing strategies is regularly higher than drugging the sufferers. Since the start of time, intellectual contamination has touched our lives. Starting with Cain and Abel, we will see Cain's obsessive behaviors and jealous outrages lead him to kill his personal brother in bloodless blood. What changed into he thinking? He desired interest that Abel received, and he desired something that changed into now no longer rightfully his for the taking. Throughout the episode Adam and Eve had not anything however troubles, and changed into regularly fed on locating a manner to continue to exist in a chaotic environment. Later via the centuries, others observed Cain's example, whilst others broke off right into a greater lethal game. How an awful lot lethal can it get whilst homicide is involved? Try homicide in numbers, or mutilation, dismembered, beheaded, slaughter, and so forth. All for the affection of cash in a few instances, and curious about the hatred buried within inside the thoughts of the lethal predators that stroll out earth. Mental ailments are available, all paperwork and none folks is excluded from ailments of the thoughts. If you've got jealousy for your blood, you've got a intellectual sick detail that might cause a miles extra hassle. If you've got envy for your blood, you've got the start of a created myth with a view to increase if the hassle isn't dealt with. In different instances, the hassle ought to bury itself beneath the floor in no way brining damage to others, however will quickly create greater awful habits. The hassle grows as intellectual fitness specialists begin dispensing pharmaceuticals that growth behaviors, psych the thoughts, and controls the thoughts, whilst burying the troubles underneath. Some antidepressants are risky if stopped suddenly. Antidepressants together with effects XR if stopped suddenly will growth signs together with suicidal tendencies, thinking, violent outbursts, enraged attitudes, impulsive behaviors, and so. The man or woman glaringly has something that changed into buried beneath the drugs and changed into prompted through the chemical substances blended with inside the drug. Antidepressants in a few times has verified risky, but intellectual fitness specialists round the arena keep to prescribed such chemical-laced risks to intellectual ailments of all sorts. It has been verified in a few times that antidepressants will growth alcohol and or drug dependency signs, in addition to inflicting main coronary heart attacks, or harm to bone structures, which results in many fractures. Examining medicinal drugs and intellectual fitness is regularly issue on the grounds that we ought to recall that the advise and the enemy are running collectively to bring about a destruction. When we consider help, we realize that once someone enables any other that it's miles continually a terrific issue. However, a number of us that agree with that we've got a chunk of paper assume that we've got all of the answers. Otherwise, a few can also additionally sense that gambling towards the chances is the pleasant answer for locating the troubles. The unhappy component is greater. Mentally sick people are conscious that the specialists are making several errors each unmarried day, and they're setting the blame on everybody, however the ones making the errors. How unhappy whilst we're all one people, one nation, and beneath one rule. When it involves the thoughts, the remaining issue all and sundry have to do is mess around with troubles existing. In my experience, I watched a psychiatrist prescribed a younger boy with tablets that created greater hassle than what changed into already in existing. The boy changed into identified with intermittent explosive disorder, oppositional defiance disorder, psychopathic tendencies, and the listing is going on, and the docs had been silly sufficient to present this infant tablets that made him greater lethal than he already changed into. In turn, the medical doctor overlooked the affected person whilst he stated this handiest makes me irritated than I already am. Now whilst this man or woman is going to jail, he's the only seen down upon. However, if a person changed into to apprehend the reality and pop out of denial, they're those with inside the wrong. Medicines in intellectual fitness are continuously growing extra troubles. Medicines in mental health. You stroll right into a reasonably commercial enterprise workplace, take a seat down a chair in a well-dressed foyer and await your call to be announced. Finally, it comes and you're assessed through an consumption worker, subsequently dispatched to a therapist per week later, after which endorsed to the workforce psychiatrist. In this quick time, you had been identified with bipolar, depression, that is in detail of bipolar, and post-traumatic strain disorder. You even have a records of diabetes, high blood pressure, and allergies. Now the physician isn't privy to the inflammatory fiber nerve disorder underlying the signs. You retain to go to the intellectual fitness professionals complaining continuously of your signs, and that they start treating you onto hypochondriasis. Someone thinking about fitness problems and maximum instances are exaggerated. You start feeling confused, upset with the therapist, and determined to see a health practitioner that unearths a fiber nerve disorder, which proves which you lawsuits are valid. However, you had been already given prescriptions for psychotic and depressive signs. You start taking the medicines and abruptly your coverage stops price at the drug Effexor XR. Suddenly, you explode feeling aggressive, trying to kill, trying to die, trying to damage, and there's no rationalization considering the fact that those emotions has in no way took place to this significance earlier than you took the antidepressants prescribed. Now the trouble has expanded and you're looking desperately for an answer, but you locate nothing. What went incorrect, you may ask? Well, Effexor XR is given to sufferers with melancholy and bipolar signs. Since Effexor is stated to goal the mind chemical compounds growing the norepinephrine and serotonin with inside the mind, it's miles claimed to put off signs of melancholy and bipolar. Now Effexor XR is notorious, as soon as the medicine is stopped abruptly, for growing behaviors including suicidal thinking, impulsive behaviors, violent outburst and so forth. The prescription has brought about growth in blood, making it a horrific deal for sufferers with high blood pressure. Now you went to the therapist to restoration a trouble, and your troubles has expanded dramatically at its miles, all due to fitness care, intellectual fitness, clinical, and so on. You begin feeling that it can't get any worse. However, the docs retain growing your drugs, prescribing tenormin, atenolol, in your ache, and after prescribing several doses of inflammatory prescriptions, which cause belly disorders, you're now taking meds to manipulate your belly. Moreover, it does now no longer forestall here. Next, you're given Impramin hydrogen chloride for ache, tramadol for ache, and turned around among antidepressants, subsequently prescribed Effexor XR again. If you're feeling on my own, you're now no longer, considering the fact that typically docs, intellectual professionals, and fitness care companies make this error excessively typically to count. It is ludicrous to visit intellectual fitness professionals all to locate intense headaches exploding your lifestyles and you're the only to blame, whilst in fact those professionals made a severe mistake. Since the intellectual fitness professional glaringly had no desire however to put off hypochondriasis, and declare that they had been handiest looking for solutions to the trouble, making excuses, you subsequently say I am looking for every other intellectual fitness professional, considering the fact that you don't have any concept what you're doing. You visit the subsequent workplace, take a seat down, wait, and whilst you are known as you speak to an consumption worker, then a therapist, and subsequently a psychiatrist. You undergo the identical approaches, questioning if those professionals are smarter than the alternative professionals you simply left, and shortly locate yourself on Effexor XR, Impramin hydrogen chloride, tramadol, and a whole lot of different medicines. I advised you human beings what show up earlier than you inform the professionals, but they forget about your cries and inform you to take your medicines as prescribed. Are we solving troubles, or are we including to the various troubles we are facing each day? Some intellectual diagnoses had been later established: a clinical trouble or primary anxious interruption that created a chain of signs delusional to intellectual fitness professionals, believing that the affected person turned into mentally ill. Caught in an internet of checking out and melancholy, we frequently combat to discover a cause that our minds are tricking us into appearing out of accordance to the so known as normal. The answer is proper in the front of them in maximum cases, but anyone is popping their heads and seeking out every other answer. What is the reason of madness, and wherein is the first-class line of sane? We can see extra in this problem whilst we checked out the mentally deranged. Mentally deranged. What is mentally deranged? Mentally deranged sufferers are frequently packed with hate and animosity and could frequently reveal a sequence of disturbed behaviors. If you need to realize the high-quality traces among sane and insane while you meet deranged, you may know the latter. Generally, deranged people are trapped of their very own kingdom of thoughts, believing unethically that the arena is long gone mad. There is a high-quality line among sanity and madness, and that is frequently mentioned with inside the courts and in intellectual health. A psychopathic thoughts is stated to be sane, but the person frequently is deranged, which means disturbances frequently occur that create chaos for all and sundry else. According to a few definitions, madness is as a result of syphilitic alteration of the thoughts, which in turn reasons dementia and paralysis, referred to as popular paralysis of the insane. The time period popular paresis defines madness. According to the time period's definition syphilitic, this venereal sickness spreads during the frame and impacts the mind, killing cells with inside the frame and inflicting main bodily interruptions. According to the regulation, madness is while someone does now no longer realize the distinction among proper and incorrect and can't recollect why she or he is in court. The later is beneath investigation, but if someone is disadvantaged of the potential to decide proper and incorrect, then she or he is stated to be insane. Insanity in psychology is deeper than each variations as described and actually a whole lot extra tough to comprehend. Now we are able to peek in the minds of the numerous prognosis to study deranged minds and madness. For example, allow us to peer into the thoughts of a sexual sadism affected person, which isn't always glaring the affected person is insane. We realize that this man or woman has a sexual disorder, which visionary hallucinations, illusionary delusional fantasies incorporates. We realize that this man or woman isn't always in truth. We realize that this man or woman has compulsive obsessive behaviors, actually due to the fact pornographic substances are triggers to those sorts of problems, and the affected person possibly has a residence packed with such irrelevant mush. The affected person enjoys and could take pleasure in rituals that consist of mortification, destroying men and women coping mechanisms, together with self-esteem, confidence, etc. The affected person whipping, torturing, additionally enjoys burning of the flesh, battering, mutilation, and every so often annihilation. This destructive, deranged thoughts will act out or suppose obsessively in this associated pains and sufferings in the course of sexual release. Meaning that the affected person is sexual gratified on the depth of the acts of hate and violence referred to on this article. Therefore, this affected person is deranged in kingdom of thoughts, and consequently we should re-evaluate the high-quality traces of madness and sane. Sexual sadism is frequently determined in people with sexual problems, together with diagnoses psychopathic persona problems. There are numerous sorts of sexual deviations, together with pedophilia, frotteurism, exhibitionism and so forth. Each diagnose has a diploma of derangement, one extra so than the different. Since we realize that derange is hate, we should compare many minds earlier than we are able to decide the sane from the insane. Cults are frequently geared and could devote crimes of hate, consequently, those humans are frequently deranged. Insanity. Maybe, however, who's inclined to step throughout the one's traces, on the grounds that an insane person can devote a criminal offense and frequently be institutionalized or released. Psychotics or psychosis is any other shape of derangement with inside the field the affected person breaks off from truth quickly and hears voices outdoor the pinnacle telling him to kill. The voices are distinct with inside the field, they will now no longer usually inform the affected person to kill. This sort of persona is risky actually due to the fact you in no way realize while an incident will take region or eruption, and also you in no way realize what the voices are saying. Therefore, if the voices are telling the affected person to kill and the affected person has no feel of truth. All intellectual sick sufferers aren't mentally deranged, but there are exceptions to the rule. After analyzing human conduct ongoing during my lifetime and have a look at psychology, biology, chemistry, science, and different areas, I actually have concluded my very own definition of madness and sane. Scientist is continuously beating down definitions, making it tough to narrate to intellectual health. Therefore, it's time a person brings to mild what intellectual infection sincerely weigh and who's sane and insane. The thoughts outdoor of the thoughts is wherein we begin to apprehend intellectual health. The mind outdoor the mind. What determines if someone is mentally unwell and what determines if the individual isn't always? According to the diverse people the definitions are all different, but if an individual's wandering technique is off stability you're extra than possibly going to discover intellectual contamination, concerning if it's far revolving round a bodily cause. The thoughts has performed hints on even the so-known as sane people with inside the international. When the thoughts creeps in suspicions, lack of thought, incapability to mention what's for your thoughts, and so on. More than possibly you're fine, but if those signs and symptoms are ongoing you had higher get assist now. The specialists in social scientists regularly interchange the phrases mentally unwell and issues due to the fact that one time period approach that a affected person has a disturbance in regular styles and the alternative approach that a affected person will want ongoing remedy for the disturbances. We cannot usually depend upon the Diagnostic and Statistical Manual of Mental Disorders (DSM) for the definition of mentally unwell genuinely due to the fact the EE book is in steady alternate as APA contributors discover new facts every year. Most facts with inside the EE book is precious, however each year new research are locating out extra approximately every diagnosis. Researchers and analysts regularly base their perception on gender, race, background, class, and so on, in addition to evaluating intellectual ailments to numerous case research. According to Crook justice specialists, the mentally unwell is observed in homeless environments and/or prison. However, that is a long way from the fact, due to the fact that we've got cops, lawyers, judges, political leaders, spiritual leaders, painters, actors, actresses and others with inside the community going to prison, or even once in a while homeless. Mentally unwell in definition is a person that isn't always conforming to the manner a set thinks, believes, acts etc. This approach in case you do now no longer go with the legal guidelines and political leaders' ideals or society's ideals, then you will be deemed the mentally unwell. According to many specialists with inside the subject of psychology, Crook Gadget, and so on, mentally unwell sufferers have been abused and disassociated from society at one time and regularly restrained government have been in a prison-like organization and the crooks in the hospital. This is dehumanizing, punishing, and person genuinely due to the fact they're stated to have a intellectual contamination. Corrupted structures bring on corrupted human beings, consequently their examples has introduced on extra issues than what all of us needed. The Crook specialists, intellectual fitness specialists, and others are continuously making grave errors for the duration of their research and regularly all and sundry suffers, but the blame is grew to become at the sufferers and others in society. Denial. Since all of us have same rights and it became a contravention of those people's rights with inside the early days while mentally unwell sufferers have been institutionalized and once in a while for no obvious cause, in any respect it's far important to undo what has been executed with the aid of using performing human and giving those human beings a standing in life. Mentally unwell sufferers are regularly tremendous people that be afflicted by a disorder. A few mentally unwell sufferers will dedicate crimes, however now no longer they all will. For example, a girl suffers retardation, but she hates the manner the sector submits to Bila, together with pornographic, immoderate violence, rape, nudity, and different regions of mention. This is brazenly recounted with inside the international as impure behaviors, but the gadget will permit it. Now who's simply retarded? Obviously now no longer the girl due to the fact that she hates what's wrong. Another case state of affairs may be visible while a mentally unwell person is out in public and a person desires assist, such as lifting groceries, and this individual will assist, at the same time as any other individual without an intellectual contamination will dismiss the want of the pedestrian. Now who's mentally unwell? The individual that became now no longer inclined to assist might be laid low with the unlawfully teachings that cross on in society, with inside the justice gadget and with inside the political international, and because of his or her worry in any other case egocentric behaviors this individual illustrated extra mentally unwell signs and symptoms than the identified individual illustrated. My factor is, mentally unwell are regularly wiser to the fact than the ones which can be stated to now no longer be mentally unwell, and the mentally unwell are regularly displaying humanity at the same time as the relaxation of the sector is dehumanizing. Learning healing techniques in intellectual fitness can assist us discover solutions to the various questions about intellectual ailments. Therapeutic strategies in mental health. There are many healing techniques in intellectual health, and every relies upon the affected person and the diagnoses. For instance, therapists will frequently use what's called eclectic method remedy for institution meetings. The cognizance of this healing approach is to get the affected person to live focused, voice their values and ideals freely without feeling threatened, discover ways to pay attention, coaching the affected person to just accept obligation and so forth. In maximum events, the companies include interpersonal, psycho-instructional, support, and psychotherapy companies. Many of the sufferers that attend every of the companies have issues socializing, staying focused, trusting others, and are frequently emotional, immature or underdeveloped. Most of the sufferers have been topics of harsh society and impractical parent instructional up-deliver. The sufferers have been in all likelihood ridiculed, mocked, punished, and so forth. The factor then is to deliver the affected person to a degree of survival that doesn't consist of worry. Another approach utilized in remedy is the life photo map. That's a technique used to deliver someone again to the modern times. Often the affected person will draw pics that hyperlink to their beyond, eventually specializing in their repute in life, after which onto their dreams in life. For instance, what do you spot with inside the photo? I see myself status on a bridge and an automobile is close by, however I can't see the guy's face. It is clear that this bridge, automobile and guy is previous and can have introduced forth worry with inside the individual. Therefore, we are able to ask the affected person, did this guy harm you? I am now no longer sure, I sense uncomfortable, however I do now no longer realize why. Okay, allow us to pass on and have a taker observe the photo drawn that illustrates your repute in life. What do you spot with inside the photo? I see someone stressed and harm. We can see that the man or woman turned into harm from this experience, so our subsequent step is to deliver the affected person to the factor of recognition after commencing up the doorways to the beyond. Next, we pass on to the aim intended, that's the affected person's future. What do you spot with inside the photo? I see someone striving to achieve his dreams. I see that the man or woman has boundaries that he need to triumph over to attain the one's dreams. Great, now we're on the street to recovery. The affected person sees hope. We need to acquire this aim. Schema-focused cognitive therapy is an approach applied in remedy to deliver the affected person to a degree of feeling and information his or her internal being and what brought about the regions of trouble. For instance, if someone has a sample of self-unfavorable behaviors, consisting of outrageous outbursts. This approach the affected person turned into taught to shout, scream, kick, combat or what have you ever, and the therapist wishes to reconstruct the affected person, bringing her or him out of the dependency and assisting them to narrate to a brand new manner of managing the hassle. It is apparent the affected person turned into taught incorrectly, and she might also additionally have persevered ache and struggling associated with abuse, neglect, and or violence. Systematic desensitization is geared to assist sufferers which can be identified with tension problems and or symptoms. The method is a trigger tension approach that enables the affected person sees wherein the triggers are in his or her attacks. For instance, if the affected person has issue whilst the telecell smartphone rings, considering she or he is in the back of it the bills, it can purpose an assault for the affected person. The affected person manifestly does now no longer realize a way to address the hassle and is threatened with the aid of using the resets on the opposite cease of the telecell smartphone. The affected person will want to research control competencies so that it will assist her or him locate a technique that works quality for her or him to alleviate the hassle area. The affected person additionally has an problem with avoidance, so consequently we want the affected person to take obligation and withstand his or her hassle. We also can see that the affected person has suffered a diploma of abuse, neglect, and or underdeveloped attaining than growth. Therapy is proving a long way greater. Medicines and these days greater techniques and strategies are in development, assisting the mentally unwell to the street of recovery. Next we can peek with inside the thoughts of some problems in dispute, one being passive-aggressive personality disorder. Types of disorders: passive-aggressive disorders and mental health. Passive-aggressive personality kinds will frequently sabotage all regions in their lifestyles with inside the feel that they frequently whinge approximately any needs placed on them. They might not voice the criticism or might also additionally do what's requested of them, however of their thoughts this is cussing the supply that what they accept as true with made them do the work. Passive-aggressive personality kinds are simply because it sounds. They frequently are passive outward and competitive inwards. The passive-aggressive kinds frequently anger others around them, but the opposite individual might also additionally sense incorrect because they may be now no longer clean on the inspiration that brought on the anger. These sorts of human beings are deceiving because they may be frequently difficult to understand with their techniques in persecuting others. They will frequently blame everybody round them in place of proudly owning as much as their component in conflicts. For example, Mary faced Bob expressing to him that his behaviors have been unconstitutional and have been inflicting problems. Bob seems at Mary with an astonished glare and says, "You're the hassle, Mary. I did what I turned into purported to do, and I did not anything incorrect at the same time as doing it. I haven't any concept what you're speaking approximately." Passive-aggressive personality issues are controversy, and a simplest one kind of ailment that the specialists dispute but use every day. Another kind of character ailment this is questionable is the self-defeating personality disorder. This kind will frequently companion with individuals with a purpose to reason damage to or persecute the distinctiveness of the self-defeated individual. This kind will even excuse any other person provide assist to him or her, despite the fact that assistance is needed. This kind may anger others round them and show harm while faced via way of means of the opposite person. The character kinds not often keep a everlasting dating and could frequently make excuses while their signs are addressed. Sadistic personality disorder turned into lately eliminated for the DSM guide in reality due to the fact the specialists did now no longer have a basis for the diagnose. The signs include controlling behaviors. They are frequently violent and could damage others to uphold their manipulate over any other person. This kind is just like psychopathic and delinquent character kinds with inside the feel they have fun after they harm others, consisting of animals. They frequently pride or entertain self with reassets consisting of weapons, torture, and different risky items. This kind will frequently into abusing alcohol and drugs, in addition to humans. They frequently are in relationships with sufferers of abuse, and could hunt down all people that they sense is straightforward to manipulate. Even if the individual is submissive, they'll locate cause to torture or harm the individual due to the fact that is what offers them pride. Persons who are suffering sadistic personality disorders are frequently survivors of abuse, and are extraordinarily irritated at the arena around them. No one is right sufficient and everybody is an enemy out to harm them of their minds. They frequently are in denial, despite the fact that they reason damage to others, they'll blame the victim. If you're around this kind, it's miles essential to get out of there quickly, because this kind is liable to murder. Similar to a psychopathic, those kinds can't hold a constant dating and could maximum continually harm the individual concerned of their lives. Antisocial personality disorders is likewise up with inside the air. Although the developments of this kind may be visible in psychopathy, it's miles rated in a different way in reality due to the fact some signs are lacking. Children if identified with this ailment are indexed beneath conduct control disorders, and after the age of 18, they may be then considered as antisocial personality. This kind is likewise risky and could damage animals and human beings. They frequently take exquisite pride in inflicting damage to others and the extra torture concerned the extra they just like the action. This kind of individual is any other individual that has issue in relationships and frequently middle out individuals which have been abused. They revel in controlling others round them and seldom take duty for his or her behaviors. It is essential to touch an expert in case you observe all people with the indexed signs round you behaving this way. Getting assist now can prevent melancholy with inside the future, and can even shop someone's lifestyles in a few cases. One of the extra not unusual place analysis could be mentioned with inside the subsequent heading. The ailment is referred to as dependent personality disorder. Dependent personality disorder and mental health. Dependent character problems are not unusual place consistent with experts. These varieties of personalities go symptoms which include incompetence to through signs and make their personal choices. They will frequently rely upon others round them to make a decision. Dependent character sorts will frequently keep away from duty and could rely upon others to deal with their lives and tasks. This sort of character will keep away from beginning tasks, except a person is there to manual them via the process. Dependent character sorts will frequently tolerate abuse, forget, which include dishonest spouse. They are frequently depressed and could use alcohol or capsules to alleviate their tension and stress. The individual is frequently passive, will now no longer guard him or herself, and is scared of rejection, punishment, and so forth. It is crucial to assess those varieties of character and now no longer confuse them with conventional ladies which have submissive trends or personalities. The specific with inside the field the conventional female will now no longer tolerate all of us going towards their ideals and could guard their individual without questioning 2 times approximately it in maximum instances. Dependent character sorts are located in histrionic and borderline personality sorts, however the distinction is histrionic and borderline personality sorts will manipulate, manage, abuse, and act out in behaviors which might be risky to others. They are very manipulating and could homicide in a few instances. The structured character kind isn't competitive and may keep a relationship, at the same time as borderline and histrionic sorts cannot. Dependent character sorts frequently want long-time period remedy because the underlying supply of the signs and symptoms is worry due to undue punishment, forget or abuse. The individual likely lived in an unruly family and became subjected to harsh punishment. Most structured character sorts will rely upon their dad and mum, and the figure will frequently discover a purpose to disregard any choices the individual makes. For instance, if the affected person is engaged and a surprising breakup takes place, the mum may also say, "I advised you so. I knew he became no good." The guy may also had been a very good individual, simply left certainly due to the fact he couldn't cope with the ailment. Dependent character kind may also even ask mother or dad if it's miles good enough to visit the store. They frequently stick near the resets that initiated the ailment from the beginning. Therefore, we're managing codependency and structured character issues. The codependency is the dad and mum in an effort to now no longer permit the affected person to transport in advance to independence. Therefore, we ought to practice a method in an effort to paintings to assist the affected person separate his or herself from the sufferers and paintings towards counting on self. I see no room for medicinal drug on this diagnose, on account that behaviors and now no longer clinical troubles have an effect on the affected person. We want to transport in advance via way of means of assisting the affected person see that worry is the basis of the hassle, after which seek the thoughts to discover the supply that brought about or promoted the worry. We can do that with Speak Remedy, because the affected person has all of the answers, but isn't aware about the cause. We recognize that the affected person became left out as an infant and likely harshly punished frequently, which includes scolding. It might be useful to get the dad and mum in remedy to assist them with their intellectual issues, however in maximum instances the affected person is in charge consistent with many for their hassle and culprits are in no way an excuse unfortunately. Now, we start via way of means of Speak Me via the issues and checking out the information, collecting roots that instigated the affected person's behaviors. It is crucial to stay regular to assist the affected person see that he or she will guard her or his individuality without being punished for doing so. We need to in no way enhance our voices or try to manage the affected person, as an alternative permit the affected person room to talk his or her thoughts freely. An inviting approach for commencing up the sufferer's thoughts is to invite questions that surround the hassle. For instance, Betty, what do you observe goes on in your thoughts? This is inflicting you issues. Do now no longer permit the affected person in charge his or herself, on account that is best contributing to the dependency. Allow the affected person room to take the ground and keep it for the time allowed. Next we're going with inside the thoughts of a psychic. The psychic minds in mental health. What is the psychic thoughts and the way does it participate in intellectual fitness? Psychogenic lies out of doors of medical perception and is regularly connected to non-secular ritualistic and supernatural forces, which can be regularly marked via way of means of influences, notion, sensory, morals, immaterial, and so on. It has been witnessed via way of means of few that trauma sufferers regularly have a better degree of notion and sensory equipment and had been recognized to have sixth senses and shared pains. This is a brand new challenge in an effort to be addressed later, however I desired to split the breakaway the psychic thoughts and regularly connected to the resets. The many psychic minds round the arena agree with they are able to speak with the lifeless and are expecting an unexpected episode. Is it feasible that someone can cross into any other global and communicate with the ones of the past? We will see. The many human beings with inside the global that has helped law enforcement officials discover murders, assist households get in touch with the alternative global, and has continued assaults on their very own lives might not have a psychic intellect, instead they will have an underlying intellectual ailments that creates an delusional outlook. We can examine magic exercise, that is a chain of acts that encompass phantasm and myth. What occurs is the individual is brought about agree with that an act is actual while in truth it smiles not. Another instance may be visible with inside the so referred to as healers. These human beings lead others to agree with that they are able to make any other man or woman stroll if she or he is in a wheelchair. I learned records in this challenge which includes that during one case the individual had a van parked out with inside the lot and microphones linked to any other man or woman that acted out the part, and the individual with inside the wheelchair changed into by no means paralyzed with inside the first place. State of phantasm myth, and this occurs regularly in our system. How is that disconnected to intellectual infection? Well, we will see that the individual is an impulsive compulsive liar that receives wealthy off deceptive others. We are alert to the truth that after someone illustrates a damning conduct it regularly results in issues which might be greater dangerous. Now we come lower back to the psychic thoughts in which those human beings are misled into believing they have got touch with different worlds and might are expecting or foreseen outdated. Most likely, the individual had a few connection with inside the first place, whether or not the records changed into in a EE book study and forgotten or what have you. We recognize from research that all people practices magic, using divination, mediums, sorcerers, foretellers and so on had been all recording for the duration of the records and were conscious that those human beings are taken into consideration evil. Evil but is the supply of the problem, at the same time as the man or woman can be very well deceived and likely struggling underlying reasons that lead them to agree with in addition to make others agree with they have got a herbal potential to speak to the lifeless. The truth is thoughts over depend is strong and might emerge as lethal if someone is twisted of their ideals and wandering process. The thoughts on my own is strong and might play hints with the thoughts that many will war to understand. However, if we exercise vigilant, and paintings closer to improving our abilities to listen and listen, in addition to analyzing among the lines, we're running closer to a healthful thoughts that only a few may have the possibility to deceive. This article in no manner meant to harm different individuals' feelings, instead it's miles geared to assist the target market examine intellectual fitness issues, the thoughts, and why matters happen. It is likewise geared to assist the target market see how jealousy, envy, lies, hate, and different factors play a big position in intellectual fitness and intellectual ailments. Many human beings with inside the global go through intellectual ailments and regularly aren't privy to this truth till the conduct that initiated the infection grew into a chain of behaviors and wandering strategies that improve to madness. The global has many issues until all of us resist fact and reality. We're by no means going to discover the solutions to the numerous issues that regularly take a seat down in the front of our faces. We are subsequent going with inside the thoughts of antisocial and psychopathic disorders. Antisocial and psychopathic links in mental health. How does antisocial and psychopathic disorders in intellectual fitness boil right all the way down to one diagnose? Let us have a look at the signs and symptoms cautiously to peer wherein this subject matter is going. First, the professionals use the diagnose conduct control behaviors or disorders earlier than they diagnose a affected person over the age 18 with antisocial personality disorder. This precise ailment regularly has different underlying problems that mimic the signs and symptoms of the real diagnose. The signs and symptoms encompass, however, now no longer constrained to hearthplace starters, truancy, theft, harming of humans and animals, hostility in the direction of authority, violent outbursts, risky sexual acts, willful or malicious destruction of property, compulsive impulsive explosions, crime, and we can't cross any similarly than this certainly, as it will scare you from your seat. Now allow us to test psychopathic signs and symptoms, which encompass hearthplace starting, mattress wetting, harming or killing humans and animals, explosive outbursts, behavior managed problems, lack of ability to treat others, destructive, truancy, neglectful, sexual deviance, hostility in the direction of authority, lack of ability to reveal regret or explicit feelings, impulsive compulsive behaviors, crook-minded, and we will cross on and on. The trouble is antisocial personalities, sociopath personalities, histrionic personality and psychopathic personalities coupled with some others all cannot display feelings and by no means display regret for his or her behaviors. If they do, it's far superficial. Now we will see that intellectual fitness and the two one-of-a-kind diagnoses link, certainly due to the fact a person is stressed in among. The variations among the analysis is slight, but there may be underlying reasons that cause them to one of a kind, while in truth the two are the identical and a person needs any other diagnosis to make extra coins off a affected person struggling with intellectual infection. Antisocial disorder and psychopathic disorder are genuinely one with inside the identical. The most effective distinction is a person is attempting to find any other device to break the primary diagnoses. Instead of pronouncing that someone has psychopathic problems, they could upload on antisocial personality disorder, psychopathic traits and tendencies and make some greater greenbacks or spend some looking to discern out what's already in the front of them. Now we will see the link, considering one is an advise of the different. This is likewise have been the confusion comes in, considering maximum professionals are conflicting over the diagnosed antisocial personality disorder. They had the perfect time period from the get-cross once they used psychopathic. Psychopathic personalities kinds are up on truth, their morals and social ideals but is what determines their signs and symptoms. They regularly have interaction is sexual exploits and are regularly gravely suffering from the irrelevant substances. Pornographic substances are regularly the main motive in the back of the thoughts of a psychopathic. Few professionals accept as true with those humans are drug addicts, but this isn't always continually true. Alcohol and tablets are regularly used for an excuse for intellectual illnesses, and the regulation and intellectual fitness professionals are liable for this excuse considering those humans are continually accusing. The fact is those humans regularly have hereditary trends and the behaviors are connected to genes. Not every psychopathic person engages in alcohol and tablets, and the records recorded has tested this. Therefore, while we're coping with antisocial and psychopathic we're seeing the identical character ailment. I even have first-hand exploited the thoughts of a psychopathic character for extra than 18 years now, and did now no longer see any proof of medicine or alcohol. The person turned into identified each with psychopathic tendencies and antisocial and having such as many strategies are located those humans may be controlled. It takes time, attempt, patience, understanding, and numerous hard love. Therefore, now no longer all psychopathic character kinds hotel to homicide if most effective the gadget could placed forth the attempt to forestall in any other case manage the character kinds. Most instances professionals will declare there may be no remedy for those sorts of personalities, and regularly those results in lethal grounds. The fact is the professionals do now no longer need to cope with in maximum instances and could wait till the individual kills earlier than a person takes the step to forestall them. Of course, it takes years to paintings via the signs and symptoms, however ultimately lives are saved. If time is extra crucial that a lifestyles then serial killers will preserve killing. We want to forestall this now earlier than a person else dies. We all want to apprehend one of a kind sorts of intellectual infection to a degree, such as avoidant.